Welcome, greetings. Welcome to the 2024 Chicago Holistic Health and Wellness Forum for MS. My name is MIndy Eisenberg, and I am the founder and director of Yoga Moves MS. I am very proud and honored to be here today to support you and provide you a space to learn and be inspired from the panel of medical and holistic experts that we have brought together to help you live your best, healthy, and whole life. For those of you who are not familiar with Yoga Moves MS, we are a community first and foremost. And if you're here, you are important to us. You are a vital member. I often hear from others about the need for connection and support, and here we are, and you are beautiful, whether you are in person or you are online with us. Events like today make us even stronger as we gather together, both in person and live online. And now a few brief words from Dr. Voci, who's the chair of Yoga Moves MS. He's been with us for over a decade, helping our organization grow. And so you'll just see a few words from him. Unfortunately, he could not be here today.
Welcome to the 2024 Chicago MS Wellness Forum. For the past 13 years, Yoga Moves MS has been bringing in adaptive yoga to the MS community. Adaptive yoga serves to reduce spasticity, help restore balance, and to put the MS patient back in control over their bodies. This year, MIndy and the Yoga Moves MS team have assembled for you another outstanding group of speakers who have dedicated their careers to helping you manage better in your MS journey. I apologize that I am not there today with you to share in this event. We had a family issue come up which has to take me away from this area, so I do apologize. Hopefully all will go well. So for today, we kindly ask you to listen, learn, and enjoy. This time is meant for you. Make the most of it, and please be safe and stay well. And thank you, MIndy, for another great event.
Thank you, Dr. Voci. Yoga Moves MS is a nonprofit that provides daily adaptive yoga and meditation online and in person. We've been doing that for 19 years. These are for donation-only classes because we want yoga to be accessible to all. As the interest in science behind holistic health is growing, it was natural for us to take this next step and make it our mission to serve the Yoga Moves community with education about wellness and integrative care. I'm happy to share the following video with you so you can learn just a little bit more about what our community offers. After today, hopefully you will join in our classes. I'm MIndy Eisenberg, and I am the founder and director of Yoga Moves MS. Yoga Moves MS is a vibrant community, and one of the components within the community is our small group adaptive yoga classes for people with neuromuscular conditions, such as MS, Parkinson's, spinal cord injury, cerebral palsy. So we can adapt yoga poses for anybody. It doesn't matter whether you ambulate with a cane, a walker, a wheelchair. What we're doing is helping everyone and anybody and everybody be able to do a yoga pose. Any pose can be done standing, sitting, or lying down, even in bed. We're taking the needs of the students into account. We don't have this sequence that has to be done in an order and in a time limit, but we're always adjusting based on the students in the room and what their needs are. So everything is to help the student help themselves towards their optimal state of wellness. Yoga Moves is so much more than just yoga poses. So I like to view our classes as a team, and the students are very much every single one of them brings their smile, their energy, their contribution to the class. When students come into our room, what we mean by community is they feel like they are a contributing, vital member of our class. But not only just in the yoga room, but when they leave the yoga room, they develop strong bonds and connections. And we do some community-based activities such as our annual fundraiser that helps to feed or provide the resources for our classes. Our students asked us for resources so that they could practice yoga at home and develop their own routine. So we've developed a book that has umpteen pictures, simple instructions, and even sequences that they can follow, so no one has to remember everything that they learn in class, but perhaps this helps jog their memory, and then they're able to develop a sequence that works for them at home. Yoga Moves offers daily live Yoga Moves classes, and now we have an Adaptive Yoga Moves Anybody online on-demand library. All of our classes are taught by experienced Yoga Moves instructors. For our daily live classes, you join along in community with other like-minded students from around the world. Our web-based on-demand library is available anytime, anywhere based on your schedule and energy level. More and more are recognizing that we are a leader in providing adaptive yoga and helping others to build a community of accessible yoga out there. It's our hope that we can help communicate what adaptive yoga is, that really anybody can learn to teach adaptive yoga and to help others with adaptive yoga therapy. Our teachers are special, not only because they have these huge open hearts, but because they've taken the time to really learn what is adaptive yoga. They've learned to be creative, and then they learn our students, and our students communicate with them, and they together create what is an adaptation, what makes yoga accessible to everybody and anybody. So we started something. Yoga became this way to facilitate the growth of a community, like a spark, and then it's just taken off.
Aw, thank you. Thank you for that applause. As you can see, Yoga Moves MS offers adaptive yoga that you can enjoy anytime and anywhere, and you can join our daily live and recorded classes. We're thrilled to see the response we had to these events. Today is our 6th year of providing an event of this kind, and 7th forum when we've had so much of this excellent attendance, which tells us this information and gathering is very important to our community. We have pulled together an amazing, and I mean amazing, rock star lineup of speakers who have in-depth knowledge in their respective expertise and topics. They will provide you with important research and concepts that are right hot off the press, state of the art. Thank you to all of our attendees. You are the reason that we're here. Namaste. Thank you to Beth Stone and Lori Spenson, who are with me here from Michigan today and make all of this possible. Raise your hands. Beth is standing in the back. Lori's in purple in the front. They think about the big picture, but also the teeny little details, and there's a lot of them that go into this. Namaste. Thank you to our amazing Yoga Moves MS instructors that teach our classes both in person and live. Thank you for the amazing work that you do with our students. You make important contributions every day for the community, and it does not go unnoticed. It's apparent and crystal clear that you are the best at what you do. I'm going to read their names in case they're listening. Mandy Bush, Anna Cairns, Jill Dunphy, Deborah Henderson, Betty Ann Hodges, Julie Levinson, Kathy McRae, Barb Wilker, and Marcia Williams. Namaste to our sponsors and exhibitors. We truly would not be able to put an event on like this without their generosity. Our top sponsor today is TG Therapeutics. Thank you, TG Therapeutics. Then we have Biogen and Amgen. And our exhibitors are Alexion, Bristol Myers Squibb, EMD Sereno, the Exercise Neuroscience Research Laboratory at the University of Illinois, Chicago, Genentech, iCompanion, Neurobalance Center, Novartis, and Viatris. Let's all take a moment to breathe in gratitude for all that brought you here today. That's your minds, your bodies, your spirit, your computers, your phones, your cars, anything that comes to mind. Take a moment and breathe in gratitude. Gratitude makes us happy. It makes us happy. You might have heard of the Happiness Project that Harvard did. So take a moment and let's say namaste to all that brought you here today. Without further ado, I would like to introduce our panel of speakers. Why don't you come on up here? Panel of speakers, 3 distinguished individuals. I see you guys coming in the back. You come up front. We want you up here. These look like comfy chairs. Thank you so much for being here today. Thank you. I'm going to read their bios because there's so much. There's no way I would memorize this. And then they're going to start their panel discussion. All right. So Dr. Augusto Miravalle, the chief of the Division of Multiple Sclerosis and Neuroimmunology, Associate Professor of Neurology, Department of Neurological Sciences at Rush University, Chicago. Dr. Miravalle is a board-certified neurologist who subspecializes in multiple sclerosis. Dr. Miravalle received his medical degree from the University of La Plata, am I saying that right? Argentina. He completed his neurology residency training at Loyola University, Chicago, where he served as chief resident of education. He subsequently completed neuroimmunology fellowship at Harvard University in Boston and a fellowship in medical education at the University of Rochester, New York. Dr. Miravalle is the recipient of the 2012 American Neurological Association Medical Education Fellowship Award, 2015 American Academy of Neurology Research and Education Award, and 2015 American Board of Psychiatry and Neurology Facility Education Innovation Award. Dr. Miravalle has been involved in both clinical and science-based research in the field of multiple sclerosis and neuroimmunology. He is a member of many professional societies and advisory boards. He's frequently invited as a speaker at national and international meetings. He's published numerous scientific articles and serves as a consultant to various scientific organizations. Oh my. Oh my, thank you. We're very honored that you're here today with all those invitations that you get. We're very lucky. Kathy Keefer. She started her career in expatriate management working for a large European multinational. She continued her professional development as a compensation and mobility consultant, working with one of the largest international HR firms, assisting multinationals worldwide with developing sound policies and practices for their global workforce. The Brain Health Center of the Rockies was founded with an ambitious vision and big open-hearted one. I can tell, it like radiates from her. To create a community in which everyone achieves their maximal brain health potential. Kathy received her degree of Bachelor of Arts from Kalamazoo College, Michigan, with a major in international affairs with a concentration on Western Europe and minors in German literature and anthropology. Kathy attended foreign studies at Friedrich Alexander Universität Erlangen, Germany. Upon graduation, she enrolled at the University of Strasbourg, France, where she received the premiere and deuxième degrees. She later completed advanced education in international relations, economics, and French at North Carolina State University. Wow. Kathy enjoys the outdoors and loves spending time with her family. Okay, Dr. Holland. This is the abbreviated version, by the way, just in case you were wondering. He's laughing because he's got multiple pages. Dr. Holland is a physician scientist affiliated with Rush University Medical Center, specializing in lifestyle and neuroepidemiology. His research focuses on modifiable risk factors and lifestyle interventions to enhance wellness and mitigate chronic diseases of aging. Dr. Holland completed his medical training at Rush Medical College and pursued postdoctoral research at the Rush Institute for Healthy Aging. His work, including studies on dietary flavanols and Alzheimer's risk, has gained global attention. How many people did you say? 4 million. Sorry, I wasn't exaggerating. It's 4 billion. 4 billion. Wow. Actively engaged in wellness initiatives, Dr. Holland serves on the Wellness Committee for the U.S. Pointer Trial. Furthermore, he contributes to Alzheimer's disease prevention advocacy efforts and holds leadership positions in professional organizations, such as serving on the Board of Trustees for Mind What Matters. Currently, Dr. Holland research explores the association between lifestyle interventions, various lifestyle combinations, and brain health, extending to additional neurodegenerative diseases like multiple sclerosis. He regularly presents his findings to academics and industry leaders. Additionally, Dr. Holland delves into pharmacoepidemiology and cognition, examining the role of lifestyle optimization in preventing COVID-19 and dietary modifications to improve neuroplasticity post-stroke. I gotta go breathe now and let you guys start. You guys are all amazing, and we feel so fortunate that you are here today.
So thank you, Mindy, for that wonderful introduction. And of course, thank you for the invitation to participate here. This is truly an honor and a pleasure to be here. And I'm going to start us off, but this is going to be a panel discussion. We are going to introduce some topics related to brain health with particular emphasis in multiple sclerosis. However, as mentioned before, most of the principles that we now know that relates to brain health in MS perhaps started with research that pertained to Alzheimer's and dementia. And many of those principles actually apply to everything we do with or without multiple sclerosis, with or without any neurodegenerative disorder. These principles actually apply to brain health. So for a moment, I want to just forget about multiple sclerosis and think about the brain and that organ that actually controls everything we do, everything we think, but it's an organ that we have influence and control on. So many of the things we're going to talk today are things that we can actually apply in our life today, things that actually we can do. That doesn't matter if you have multiple sclerosis or not. Those are things that actually now we have evidence that helps to keep that brain as healthy and the optimal function of the brain as active as possible. And without further ado, let's just define the objectives for today. So we are going to discuss the scientific evidence that supports the incorporation of lifestyle interventions in multiple sclerosis. And then we are going to review models of care that aim to incorporate these activities into our lives with MS. So let's start with some myths that perhaps you heard or you even said that, some of those things actually continue to circulate online, and they prevent us from actually being able to incorporate these lifestyle interventions in our life. One of the things is, behavioral interventions don't change the course of the disease. Well, we know that that's not true, and we'll discuss some of the evidence that supports that statement. The other one that actually usually comes from us, from physicians or from healthcare providers, we don't have time to promote lifestyle interventions with our patients. And there is some truth to that. When we approach the care of our patients in 30-minute visit, we usually concentrate on things like the physical exam or taking a history, looking at an MRI, looking at the blood work, and we usually don't have time to talk about, tell me about your diet, tell me about your exercise, your quality of life, your sleep. So there is some truth to the fact that we don't have the time, but if we only look at the time spent in the clinic, but that doesn't mean that we should not incorporate these recommendations into the care of our patients. Also, there is another myth that usually circulates, that there are limited resources for MS patients with advanced disability. And as MIndy mentioned before, it doesn't truly matter how much disability someone accumulated. We can always do something to help our patients improve their brain health. And the last one, that is the one that actually personally insults me, and I'm sure everyone that actually is involved with lifestyle medicine, that lifestyle medicine is a soft science. Well, it is not. There is a lot of evidence coming from rigorous research publications that actually support the recommendations behind lifestyle medicine in multiple sclerosis particularly. So just to get us all into the same playing field, let's review very briefly what is the natural course of multiple sclerosis in today's language, to today's standards. And perhaps I've seen some of you that perhaps you had MS for many decades. And it's possible that in the past you heard your physicians talking about certain terms that now we are slowly not talking as much, like this concept of moving from a relapsing MS to a secondary progressive MS. Those terms are becoming less popular these days because we recognize that those clinical labels were established in the past when we didn't have biomarkers, when we didn't have our knowledge of the pathophysiology of MS that actually supported the knowledge that actually MS is one continuous disease, that in that journey, MS patients may develop certain symptoms and signs that we call relapses, and that's what you see here in these bars. So those relapses are very frequent early on in the course of the disease. And for those of you who wants to know more about that, the definition is right there, which is the presence of signs and symptoms that last at least 24 hours and is not explained by anything else. It's not explained by infections or fever or stress. And as you can see in the graph, these relapses, after they resolve, there is usually an accumulation of disability that lingers and is a residual deficit that comes from that relapse. We rarely see that the recovery from a relapse is complete. So if you start accumulating problems after each relapse, in the course of someone's multiple sclerosis, there is going to be an accumulation that we now call relapse-associated worsening, also known with the acronym of RAW. So perhaps you've seen this term online, and it's good to kind of explain what that means. So that's one of the main contributors to disability, which is that accumulation of disability that comes as a consequence of an incomplete relapse. But as you know, that's the manifestation of something else happening behind the scenes. And I'm sure you had MRIs at some point. Raise your hand if you had an MRI for... See, I see a lot of hands. And I'm glad that's happening. MRIs, we use that as a tool to not only diagnose MS, but also to monitor the disease process. And not all the lesions in an MRI will cause symptoms. And perhaps you encounter situations in which you had an MRI, particularly early on, after having maybe one relapse, and to your surprise, that MRI showed 8, 9, 10 lesions. And what is that? What are these lesions doing to you? What are these lesions affecting? Well, those lesions are usually affecting what we call the brain reserve. Just show me your hands. Who is familiar here with the concept of brain reserve? All right, I see 4 hands. Hopefully at the end of today, everyone raise your hand. So what is the brain reserve? And that's exactly why we're here. Everyone that is doing work in brain health, the main goal for work in brain health is to promote a healthy amount of brain reserve. So for a moment, look at your brain from a functional standpoint as an organ that has two main functions. One is to do the things you want to do every day. That's the active brain that approximately equates to 10 to 15% of the amount of function that the brain can accomplish. But we have an amount of brain that is actually there to support other activities. Let's say tomorrow you want to learn something new. You want to learn a new language, you want to learn a new instrument, perhaps you want to do something new in terms of your physical function. Well, you're going to need additional brain in order to support that new function that you're bringing into your life. And you're going to start using neurons in your brain reserve. So if you translate your brain to your bank accounts, your active brain will be your check-ins, and your brain reserve will be your savings. So constantly we are transferring brain cells from our savings to our check-ins depending on what we do with our life. So if you speak English as your main language, you're using a lot of cells in your language area, and they're specialized and they're well trained to speak English. But let's say tomorrow you want to learn French. Well, what the brain is going to start doing is using some neurons from your brain reserve in your language area and train them to speak French. And when you become proficient at French, all of a sudden you enhance the amount of neurons in your language area to have certain neurons that speak English, certain neurons that speak French. And that's how you learn. That's how you establish new functions in your brain, by the things that you choose to do with our life. So that savings account, that amount of brain that we have called the brain reserve, is something that early on, particularly MS lesions, could affect. And that's why you don't see that all the lesions that we have in MS will cause symptoms. Going back to your bank accounts, if someone is stealing money from your check-ins, you probably notice that right away. But if someone is constantly stealing money from your savings accounts, unless you're checking that every day, you probably won't notice until you need to use that money, and all of a sudden you see that your reserves are decreased. So that's the same concept of having lesions on the brain that are not causing symptoms early on, but as you age and you need to start using that brain reserve to compensate for aging, all of a sudden you're like, wait a minute, I don't have as much brain reserve. And that's when we used to say that someone with multiple sclerosis over time will slowly find this decline of neurological function. We used to call that progressive MS. We still call that progressive MS. And we used to say, well, someone goes from a relapsing to a secondary progressive. Now we are thinking of these processes as simultaneous processes that are happening together. So as patients accumulate disability from relapses, they are also accumulating disability for that slowly progressive phase of the disease. That the term that we use today is progression independent of relapse activity. So those two processes are happening simultaneously. And the goal for therapy is to be able to identify them and to be able to stop them. So here I also added the neurological reserve or the brain reserve. And as you can see early on, it's going to be there in the background trying to mask or compensate for the damage that is being caused in multiple sclerosis. But as the disease continues, there is going to be a point in which the exhaustion of that neurological reserve, it's not going to be able to compensate for neurological function. And at that point, when the neurological reserve is no longer able to compensate and progression continues to accumulate, that's when we see that patients actually start to slowly manifest those symptoms and signs of progression, slowly having difficulty walking, needing to use a cane for ambulation, slowly having this cognitive decline that appears to be affecting everything that patients wants to do in life. Any questions or any comments? And there's going to be plenty of opportunity to ask questions at the end, but anything burning that now I need to clarify? Oh, there are two questions, okay?
Thank you. Is there any contraindication for, how's it pronounced, Charcot-Marie-Tooth patients to practice yoga? Any contraindications for that?
Okay. So that's a great question. So patients with Charcot-Marie-Tooth, which is a type of hereditary neuropathy, it can present with different types of Charcot-Marie-Tooth. And patients usually have anywhere from sensory to motor deficits. So indeed, there is no contraindications, but usually what I recommend in those patients is to have a visit with a physical therapist to make sure that it's safe to do any type of physical activity, particularly to prevent falls. Sometimes these neuropathies in Charcot-Marie-Tooth can cause decreased proprioception, which is the sense of balance when we are not looking. And sometimes some of the yoga poses that you can do may trick the brain and you may fall. So what I will recommend is perhaps have a visit with a physical therapist to make sure that it's safe.
Just so you know, these questions are coming from our virtual audience.
Okay, I figured that out.
Yeah, the second question is, can MS lesions be a cause for seizures? If so, would seizure medication be effective?
That's a great question. So going back to the lesions here, so the location of lesions varies, and MS can affect pretty much every component of the central nervous system. In the past, we used to think of MS only as a white matter disease, but now we know that MS can affect the gray matter as well. So when these lesions are very close to the cortex in the outer layers of the brain, they could eventually irritate that cortex around the lesions, and that can manifest as seizures. So lesions can cause seizures. It's rare. It's not a typical presentation, but it could happen. And in that case, we usually recommend treatment with anti-epileptic medications to decrease the likelihood of seizures in the future. Very good. That's an excellent question. Yes, sir. Excellent question. I'm going to repeat that for the audience. So the question is, we see a decline in neurological reserve as we see here, right? And that happens as natural history. So the question is, can we reverse that and bring the neurological reserve levels up? And the answer is yes. And that's why we are here. So what are the things that we can do to bring more money into our savings accounts, right? To improve that neurological reserve. And that necessarily doesn't mean to have more neurons, but means can we make the connections between the neurons that we have more efficient so that through training, we can make the whole system be more effective for what we want to do? And the answer is yes. And that's why we talk about exercise, we talk about healthy nutrition, we talk about lifestyle interventions that makes a difference. Okay, so I need to speak on the microphone that one. So thank you, Kathy. These are just for those of you who wants to know a little bit more about that savings account, the neurological reserve. We always say, well, there are two types. One is what we call the passive brain reserve, which is your hardware, the amount of brain that we have, the amount of neurons, the size of the brain. And that's usually determined genetically. And when we are born with X number of neurons. And there is little we can do to truly change that. And that's how we are wired. And MS can affect that, of course. And have you heard of brain atrophy? So brain atrophy is a process of shrinkage of the brain. All of us here, as we age, we go through a process of atrophy. And that happens just naturally as a consequence of aging. But in multiple sclerosis patients without therapies, that rate of atrophy could be as high as 1 to 1.5% per year, whereas in healthy aging is approximately 0.2 to 0.4% per year. So we know that if we don't treat multiple sclerosis with therapies, there could be an accelerated rate of atrophy. Some of the medications that we have approved now, particularly those highly effective therapies, can drop the likelihood of atrophy to levels that are comparable to healthy aging levels. So that's one of the benefits of being in certain medications for MS. But the other brain reserve, that's the one that actually we can shape and we can influence with the things we choose to do in life. Also known as the active brain reserve. That's your functional brain. That's how your brain works. Going back to a computer, that will be your software. How many programs you put in that computer of yours? How many functions you ask your brain to do? And we can influence that brain reserve through the things we do in life, our educational attainment, our physical activity, our diet. And that's the part of the brain reserve that actually has the most influence by the things we choose to do. So we kind of covered this already, which is that concept of brain atrophy. And for those of you that like numbers, these are the rate of brain atrophy that we see in healthy controls, MS patients without medications, and as I mentioned before, in individuals that are receiving medications, it's reasonable to expect a benefit that could be measured with atrophy rates similar to those individuals that are healthy aging without multiple sclerosis. But let's talk about the function of the brain. Have you heard of a functional MRI? I see someone say yes, absolutely. So a functional MRI, well, it's a technique that doesn't look at the structure, but looks at the function. So how the brain works in response to certain activities. And as you can see here, that was a healthy control that was asked to perform a motor function. And in this case was finger tapping. And what the functional MRI does is measure the parts of the brain that get activated as a consequence of that function. And anything that you can see in orange and red are parts of the brain that individual is using in order to perform that function. It's kind of cool, don't you think? So it gives us a sense of how the brain is working, what parts of the brain are active. So the investigators did the same task in an MS patient. And this individual had the same age, the same gender, but had multiple sclerosis. And they asked this individual to do the same function. And when you compare the two, which one has more red and yellow? The top one or the bottom one? The bottom one, right? Full disclosure, if I give you options, the correct one is always going to be the second one, okay? So that now you know, you have no excuse. So very good. So exactly, so the bottom one has more brain activation. What is that telling us? So that's telling us that that individual, in order to perform the same function, had to use more brain, had to use more parts of the central nervous system in order to accomplish that function. Would you agree? Excellent. So now the question for you, this is just finger tapping. But now imagine that that individual has to go to the grocery store, has to take the kids to school, has to come home and make the dinner, and has to do all the things that we usually do on a day-to-day basis. And for everything you do, you're activating more brain cells. How do you think that person is going to feel at the end of the day? Exhausted, right? Well, that's one of the ways, a very visual way to understand fatigue in multiple sclerosis. Why are we tired? Well, because you're constantly having to use more of that brain to do the things you want to do. You're constantly having to recruit more brain cells from your brain reserve to be able to do the things you want. So usually when I show that to my patients, that's one of those moments in which, like, well, now I get it. Now I understand why I'm exhausted at the end of the day. My entire system is being asked to perform at a higher level to be able to compensate for those lesions causing demyelination and making the whole system feel slower. Okay? So going up to a question that I was asked before is, can we make this whole system more efficient again? Can we retrain our brain to go from this state to that state again? What do you think the answer is? Yes, and that's why we are here. Very good. So let's look at another study that now looked at motor training in an MS patient as a way to improve plasticity. And this is the first time I mentioned the word plasticity, but at the end of today, not only are you going to be an expert in brain reserve, but also you will be an expert in plasticity. So what is plasticity? It's the ability of the brain to rewire, to change the way the brain cells work, the efficiency in the system. So they did another functional MRI study in an MS patient, and this is a baseline scan, and it's kind of small, but hopefully you can appreciate the fact that there is a lot of orange, there is a lot of red, and a lot of yellow. And again, that was a patient that was asked to do a motor function. So that individual was activating a lot of brain cells in order to perform that motor function. So what they did after that study is they asked this patient to enroll into a 3-month-long physical therapy and rehabilitation program. And the whole purpose of that program is to retrain that individual to perform that function better over time. So at the end of those 3 months, they did another functional MRI. And what do you think happened? Improved. And the amount of brain that individual had to use to perform that function was significantly smaller. So what this is telling us is that brain, and all of our brain is the same way, is very trainable, very plastic. We can actually modify the efficiency of that function by the things we choose to do. And particularly if you train that function with the proper exercises and the proper guidance, you can expect to see improvement in the efficiency of the brain. So let me ask you, and that was not part of the study, but let me ask you, how do you think that individual will feel at the end of that 3 months training? More fatigued or less fatigued? Exactly. And that's the whole point of understanding how exercise, how physical activity can not only improve motor function, but actually improve the way we feel after we do that activity. And even though it may sound counterintuitive for you when we say, hey, you're tired, you're fatigued, you need to exercise more, it's like, wait a minute, that is like opposite of what I thought I need to do. Well, that explains why. Because yes, you may be more tired at the end. It will get worse before it gets better. But with proper guidance, we should expect that the whole system becomes more efficient, so you actually can do more and you can be less tired. Is this making sense to you? Good, excellent. How about people with minimal or no motor function? Can you get the same benefits? And that's one of the things science becomes a little bit more this mysterious area that, this study reminds me of how wonderful the brain is and how many things we don't know about the brain. So this study looked at individuals without legs. Those were amputees. And they were comparing with people with legs. And they asked the individual without legs to think about, imagine moving those legs. Kind of crazy if you think about that. And they compared the amount of cortical activation in the amputees versus the control. And you can see that there is a lot of concordance in the amount of areas that activated the brain by just thinking about movement, even though they didn't have the lower extremities. So this is a pilot study published last year, and we're going to start to see a lot of this because the whole point of this study was to say, well, let's say someone has minimal motor function in lower extremities. You unfortunately are in a wheelchair with minimal function, but can we still train your brain to think about movement in the same way that you will routinely exercise? It's not just think for a second. Imagine the movement, right, left. You go through the whole routine in your head. And can we expect similar benefits in the whole amount of use of that neurological reserve as individuals with movement? So more to come, but that's something that I want to plant a seed in your head to start thinking about how wonderful the brain is, how many things we can do even in the context of minimal motor function. Is movement the only thing that we can do for our brain? No. There are many things that actually have benefits in our brain health that go beyond just movement. And one of those is music. And I think all of us here share a passion for music, myself included. And music, when we are exposed to music, is a comparable amount of brain activity that we get pretty much with every aspect of the central nervous system, comparable to a workout. So music, it functions as a stimulation that can promote neuronal plasticity. When you look at, for example, musicians, MRI studies looked at the brain of musicians compared to the brain of non-musicians, and they found that certain parts of the brain are larger, particularly one area called the corpus callosum, which that's very thick bridge that connects the right to the left. That's an area that is affected in multiple sclerosis. And individuals who actually play music as a professional activity, they have larger areas consistently, including the corpus callosum and the cerebellum as well. But listening to music, you don't have to be a pro. If you listen to music, has a profound effect in things like working memory, anxiety, and depression, which are very common problems in multiple sclerosis. So I believe I have a few more minutes left, but I'm going to dive a little bit deeper into an area that is a passion of ours. And Kathy, in a few minutes, she's going to explain to you a program that we offer called the Brain Health Program. And the reason why we have this is it's extremely difficult to understand all the things that we know in MS brain health in one setting. Probably after today, you may leave the room inspired and you probably learn something, hopefully, but it's extremely difficult to learn all of these aspects in one setting. So what we have established in the nonprofit that we funded, but also at Rush, is a longitudinal educational program that will allow patients to understand these complex topics in a way that is in a better pace, and also using a mechanism called planned redundancy, which is if you have to explain something complex, you have to introduce that topic in multiple sequential longitudinal ways. And every time you explain that, you increase the amount of details and you dive a little bit deeper. So at the end of that program, you truly become a pro. So we apply that principle in the 3-week brain health program. But I'm going to do just a small sample of that today. So now you know the whole concept of brain reserve. We talked a little bit about efficiency, but let's dive deeper. Let's go to the cellular level. This is what a neuron is, and that's our brain cells. So as you can see there, it's very complex. You have DNA, you have RNA, you have proteins, receptors, and then you have this concept of called dendrites. That's how neurons talk to each other. So it's simple to think about neurons as a simple cell, but it's actually a very complex cell. And the amount of dendrites and the amount of chemicals that go in between those dendrites have a profound effect in brain function, has also a profound effect in mood, in depression, in anxiety. So I'm going to just walk you through the evidence that we now have that exercise affects the neuron, and exercise affects all of these components around the neurons. So the first one is perhaps the easiest one to understand. So exercise promotes neurogenesis. If you are my age or older, and if you went to med school, probably you learned that we are born with X number of neurons, and you can't make new neurons. Well, we now know that that's no longer true. There is a process of neurogenesis, particularly in parts of the brain called the hippocampus, which is in the temporal lobe. That's the area that actually allows us to remember, to learn, to memorize. So you can create new neurons in certain parts of the brain. And exercise is one way in which it's been established that individuals with or without MS can improve the number of neurons in that particular area. So now that you know that, and you know that the hippocampus controls memory, what do you think is going to happen in people who exercise with their memory? Gets better. So, and that study looked at individuals that were at baseline very fit. They were doing exercise for more than 150 minutes per week for 6 months. They looked at individuals that were not doing exercise, and they were looking at individuals with a cognitive function at baseline. And all three groups actually had a benefit, but guess what? The individuals who were at baseline more fit and increased the amount of exercise got higher, better benefits. So there is a dose response that we see with exercise. It helps everyone, but actually you don't need to wait until you have a problem to benefit from the exercise. If you start doing exercise before the problem occurs, actually you get better benefits. So that's one of the reasons why we promote the use of exercise in MS care. Another area, this is a way to improve the connections between neurons, something we call long-term potentiation. So we talked about these neurons talking to each other. So exercise also showed to benefit the efficiency of the communication between neurons. And in the interest of time, I'm going to go a little bit faster. But something that Dr. Holland is going to talk about today, which is the role of prevention of disorders, chronic disorders in general in brain health. Exercise was found to have a profound effect in preventing diseases, particularly cardiovascular diseases, in individuals in large studies. This is Dr. Model's slide, and I have to say I have to give him credits for everything he has done. And those are the benefits, the summary of benefits of exercise in different parts, not only in improving muscle strength, balance, decreasing fatigue, but also if you pay attention to this area, his lab suggested that exercise actually can be seen associated with decreased relapse rate, decreased lesion volume, and improvement in certain structural gray matter structures like the thalamus. So how often we recommend. So there are now guidelines that gives us a sense of the type of exercise, the amount of exercise, and whether it's aerobic, whether it's strength training. And we share these guidelines with our patients at Rush. And of course, we share these guidelines in the 3-week brain health program that we offer. And we talked about music, we talked about exercise, but also other aspects of brain health are important. Here is a very brief summary of nutrition. Dr. Holland is going to talk to us more about nutritional strategies in brain health. Vitamin D deficiency, we know that it's a risk factor for MS, and also is a factor that when corrected can make the course of the disease better. And also smoking cessation is critical. Smoking is not only a risk factor for MS, but also can be associated with worse clinical outcomes in individuals with multiple sclerosis. So what do we do now? So we kind of very briefly discussed some of the evidence behind lifestyle interventions in multiple sclerosis to promote brain health. So the big question now is, how do we apply this into the life of our patients? How do we help individuals accomplish brain health? So kind of moving from the what to the how. And before we do that, we need to help patients understand the why. So I thought to share with you a case. This is a case that I created. It's not representing a real patient, but in a sense, it's a patient that perhaps represents a common scenario that we see in clinic. So Lisa is a 45-year-old woman diagnosed with MS at the age of 32. She received treatment with a medication called Tecfidera. However, this continued due to side effects. And she decided to never start another disease-modifying therapy because she wanted to follow a natural approach. Lisa works full-time. She has a graduate degree in business administration. And she read somewhere along her journey a book about the health benefits of celery juice, and then became an advocate for celery juice in multiple sclerosis. And now she is complaining of severe fatigue, has 2 new lesions on the MRI. So this is not unusual. We have encountered situations like that. And the challenge that I pose here is we want to honor Lisa's approach to being healthy. We want to honor Lisa's approach to natural. However, we also want to offer Lisa all the tools that we have that we know that have a benefit. So how do we reconcile everything? How can we honor Lisa's wishes, but at the same time helping her getting the benefits from everything that we know that can help in multiple sclerosis? And this brings us to Google and online and data. And everyone now is bombarded with data, and data is at our fingertips, and we hear things from colleagues. We go to a meeting and we hear something from the person sitting next to us, and we go online and these social media platforms, they learn very quickly that we perhaps have MS, and they're going to start sending you all this information every time you go to Facebook or to go online. So data is everywhere. But data doesn't necessarily mean that it's information. So information is when we can start putting that data into a story, something that actually makes sense, something that information will have some degree of context. But information could still be not accurate or not valid. Information could be evidence-based, and that's when it comes from rigorous studies that looked at research and tried to provide evidence behind that information. Information could be opinion-based, and we are exposed to that constantly. Some of that opinion could come from substantiated, valid reasons. Some of that opinion perhaps is biased, and I will argue most of the opinion that we have some degree of bias. And then you have flat-out misinformation, information that is not accurate. So how can we navigate all of this? And well, but there is another step. So when you start putting pieces of information together, that's when we build knowledge. And knowledge is something that helps us sometimes to answer questions. Knowledge is something that can help our patients say, well, what is the best course of action that I should take for my multiple sclerosis? What is the right diet that I should follow? What is the right amount of exercise? Well, if that knowledge came from information that is evidence-based, that's wonderful. That's when give patients wings and empower patients to be able to take control and be your best advocate. But when that knowledge comes from obscure sources and from misinformation, patients can end up in a situation in which they believe in things that may not be real. And so how can we help patients actually get to the right information, the right sources, build the right knowledge to ultimately get what we all hope, which is improve your healthcare literacy so you can empower yourself to take the best control of your life and be your best advocate. So as you can imagine, this journey is complex and it's very difficult. And as I mentioned before, it's nearly impossible to cover all of this in one setting. And it's very challenging also to do it in the clinic when we are usually distracted with looking at MRIs and looking at side effects and trying to address, more urgent matters. So for that reason, we decided to build a program that hopefully will expose our patients to evidence-based information. There is some opinion-based information, but it's opinion that comes from individuals who have expertise in that area with the aim to improve our patients' healthcare literacy. And with that, I would like to pass now the microphone to Kathy Keefer, who is going to walk us through how this program looks like. But before I do that, I want to answer that question. I think we can make it available, right, Mindy? I'm happy to make it available for you. Okay, it will be at the virtual exhibit hall. All right. So now Kathy is going to walk us through how do we go about providing this service to our patients.
Thank you, Dr. Miravalle. Thank you, MS Yoga Moves. This truly is an honor. So as MIndy had mentioned in my bio, I do not have a science background. My background is something entirely different, but I have come to love this work more than anything that I've done in my corporate field or in the consulting realm. So talking about education, and again, I think that's a really vital role of the piece of patient care. And as Dr. Miravalle had mentioned, oftentimes time is just too short when you're in the clinic with your MD. And I think it's really important to kind of break down the pillars so that patients truly know the various resources that are available to them. And that goes beyond just your doctor. It is looking at, your overall nutrition, your level of exercise, your sleep and comorbidities, anything else that might be going on in your lives, your social aspect, your cognitive realm. So, of course, the emotional and anything else that might be happening. So these are really the pillars around brain health that need to be stressed and I think are really a part of our lives, right? So let's kind of break this all down and look at health in a much larger realm. So I think the American Academy of Neurology has a great definition of brain health, where they say a continuous state of attaining and maintaining the optimal neurological function that best supports one's physical, mental, and social well-being through every stage of life. So again, it's a much bigger picture, and I love seeing that brain health is becoming such a hot topic these days and receives a lot of focus and concentration. So what have we done? And again, we've started a multiple sclerosis brain health clinic through the nonprofit that we co-founded out in Colorado, the Brain Health Center of the Rockies. And I've been running an MS brain health program for almost 6 years now. But we have been fortunate enough to see that there is enough attention by various large institutions. So we are now taking this to Rush. And as part of that, there are components that go along with it. So we want to make sure we are providing the education that patients feel empowered, they can advocate for themselves and truly understand the resources that they have. So that's where I host our MS Brain Health educational program. But we want to integrate that with the care that they receive within clinic. And then, of course, building that into a research component as well. So that kind of is the full circle of what is provided at Rush. And is a big part of the overall brain health program. So I'll kind of go through that quickly. So I think a big part of all of this is talking about the change cycle. And the big aspect is, first of all, identifying the problem. What is truly happening with this disease diagnosis that you have received? What are your symptoms? What is the problem? So identifying the problem first and foremost. Then is a question of why, and truly understanding the problem. That's where, the education piece is super critical. Then we want to see that from the education pieces and things that you learn, that you are actually putting that into execution and you actually make that a part of your life. Then let's make sure we're assessing that things are happening the way they should. So assessing outcomes and that is being maintained. So we want to make sure that there is the full circle of implementation for better brain health. We'll go through this a little bit quickly. So again, identifying the problem, assessment of physical, emotional, and mental status during a clinic visit, conduct a baseline outcome, and then developing a personalized brain health plan. Now, I think I want to focus in on the personalized piece of this because there are a lot of large, wonderful webinars provided to patients. But what has been hypercritical in the programs that we have established and has been vital for me all along is to make sure that I touch every single patient that comes through and does this program with me. And what I mean by that is I like having those smaller group settings over an extended period of time where we can truly interact with one another, that the questions are being answered that are specific to you. So having that personalized approach, I think, is where ultimately you gain the most because you're feeling like you're being heard. So this is the patient education and for medical intervention. So again, I am running that 3-week brain health program. We also provide monthly conversations in brain health. So this is all somewhat interconnected. and then making sure that we have a larger get together, some kind of an annual event, because we all enjoy those social events. So this is part of ultimately the bigger understanding the problem and implementing this into more of a longitudinal approach. So after you have completed my 3-week program, I don't want you to think, okay, slap my hands and I'm done. We want to make sure you continue to stay engaged with updates that are occurring in the brain health realm. So that's ultimately where that all comes together. So we have, over the last several years, taken various approaches to this MS Brain Health program. We started out doing things in person, which was great. We would meet every Friday morning. But then COVID, like everybody else, we had to take it to a virtual platform. We maintained a similar format, just having our instructors teach. But what we have found to be the most effective is what we call a flipped classroom model. And this is where I have you as my students do some homework up front. This seems to be really effective, where we have pre-recorded videos that we suggest that all of the participants watch prior to our debriefing with instructors for each session. So we want you to come prepared to class. So you watch the videos, we get together with the instructors, debrief, and kind of hit high-level topics during that session, and then allow for Q&A. So that's kind of this approach of, again, upfront learning and making sure that during our live sessions we are the most productive, and that we're really kind of honing in on specific topics and terms. So this is ultimately a little bit of a demonstration of our online videos that we provide. Each day we have broken out, there's 6 sessions of the 3-week program. And we go into, I think it's my next slide. Yes. So I'll talk to this first and then I'll go back. So day 1 is really more going into the epidemiology, risk factors, kind of this MS 101, so we truly understand the disease itself, and talking about disease-modifying therapies. Day 2 is more talking about building your brain reserve and cognition. Day 3, we've noticed that we used to have it separated between physical therapy and talking about your physical well-being, where we had physical therapy as a separate topic, because exercise is actually proven to be one of the most effective realms of brain health. I mean, there's the most data behind it, so exercise deserves a lot of attention. But I have partnered that session together with occupational therapy, simply because oftentimes a lot of individuals get confused around, well, when should I be seeing my physical therapist and when should I be seeing my occupational therapist? And there's most definitely a lot of overlap. So that is our day 3. Day 4, I like to break it up with some fun. So everything is kind of front-loaded at the beginning of the program, a little bit heavier, but you have to introduce some fun and easy ways to integrate, brain health in a simple format of music. So we have music therapy on day 4. Day 5, Dr. Holland, who is sitting right here, is my nutrition guy. And really talking about the gut-brain connection, what is causing potentially inflammation that is, causing a flare-up of symptoms based on, the food that your nutrients that you're putting into your body. So it's a very important element of brain health. And then day 6 really is talking a little bit more about symptomatic therapy, kind of closing that loop of what Dr. Miravalle was talking about earlier of brain reserve, making sure we really drive home that these are the important factors that contribute to your overall brain health and how you can maintain brain reserve. So ultimately and I'll real quickly go back. This ultimately is kind of how it's set up for patients where they can go in and watch videos for each of those breakout sessions. So we've been very fortunate to kind of do the pre and post evaluation of how these programs have worked and have had some really great outcomes in the data of effectiveness and that it actually has provided a better understanding of the disease state, understanding the resources that are available within their community and who to reach out to, but ultimately benefiting in more of a long-term effect to maximum brain health. So I think that might be it. Well, yeah, I think that's pretty much it. We've talked mostly about this already. Yes, so I will turn this back over to Dr. Miravalle.
Thank you, Kathy. And as Kathy mentioned, so this is underpinning of all of that is a research program that we are building up. So we currently have the clinical component pretty much established, which is all these outcomes. And we are working with incorporating serum-based biomarkers and MRI biomarkers. And so as you can see in the long run, this is longitudinal intervention that we have from the clinic space that patients have a one-on-one consultation with a nurse practitioner, Adrienne Castillo, on brain health, where she does truly take her time to look at all the different aspects. The educational program that Kathy mentioned, the 3-week brain health program, the conversations on brain health, and then the development of that personalized plan and that longitudinal assessment. So with that, we are hoping that over time, with everything that we discussed, we can bring that level of neurological reserve as high as we can. We can stop relapses with our therapies that we have, and we can hopefully help to beef up that savings account in our brain so we can do the things that we want to with minimal problems. So in summary, hopefully I can convince you today that all these myths that we discussed before, that lifestyle medicine is a soft science, that we don't have the time, that we don't have the evidence. Well, we do. We do have now the evidence that lifestyle interventions make a difference in multiple sclerosis. I will argue that neurologists, we should be playing an active role in promoting lifestyle interventions, whether it's through programs that we can educate patients and communities, or through active process of referrals to all the different players in healthcare that can actually help us, helping our patients to accomplish ultimately optimal brain health potential. And with that, I want to pass it to Dr. Holland now to take us to another area, which is nutrition. Thank you.
Thanks. All right. Okay, we'll get this figured out. So first, I see you all have food now, getting it going. How appropriate that we're going to be discussing dietary interventions along with other lifestyle factors. So today, I'm going to provide some information on risks for cognitive decline, dementia risk, and tie that in with the lifestyle factors, but how our lifestyle factors are going to impact the progression of a lot of different disease processes. So a mentor of mine said that the best life or end, if you will, would be that you're 90 years old, you have all of your cognitive abilities with you, you have physical functionality, you are able to go ski the slopes, finish your day, have a glass of whiskey and a great conversation and go to bed that night and not wake up. That would be ideal, right? We're 90 and we have everything intact, both cognitive and physical functionality. But for a lot of us, that is not the case. There's either going to be a progression of decline in physical functionality or a progression in cognitive decline. We're going to be going over navigating life with MS, but how those lifestyle factors can impact us over time. All right. So, basics. We know with multiple sclerosis, it's going to be a disease of the central nervous system, and it revolves around the demyelination of the neurons. So we're going to be going into a lot of the physiology of the disease process itself. It's going to be characterized by sustained inflammation with eventual neurodegen. And the presenting symptoms can be as simple as lid lag. Somebody wakes up and they have some vision abnormalities, or it could be foot drop, where we're walking along and all of a sudden our foot starts dragging, and eventually, dependent upon the sidewalk you're on, could lead to a fall. So some of the factors that are going to be affecting the pathogenesis are going to be genetic, but there's also going to be other things involved. So that could be environmental factors. It could be viruses. It could be underlying comorbidities. Now, one of the main things that I do a lot of research in is the oxidative injury. And so whenever we talk about oxidative stress, we're usually talking about the immune system itself. So the immune system and an inflammatory response is normal functioning. But within our cells, we have these reactive oxygen species that are meant to break different components down. But sometimes those oxidants are going to cause oxidative stress. We're also going to have an inflammatory response. And that inflammation is very good, but sometimes that inflammation is going to be either increased in amplitude or increased in duration. And that can lead to cellular damage and eventually, if that's in the brain, causing damage to neural tissue. So we need to first identify populations at risk. Because if we can understand who's at risk, we can start thinking about what we need to do to modify those risk factors. So elderly individuals, especially greater than 60 years old, minority populations, so specifically African American and Latino American are going to be at increased risk for progression of disease process. Also, sex determination, although it's inconclusive, there is data that suggests that males are at higher risk for more intense adverse outcomes. Also, immunocompromised. So if the immune system is already not functioning appropriately, the capability to function normally later on is diminished. Now, these underlying comorbidities, the one thing that I see whenever I look at this, obesity, cardiovascular disease, hypertension, diabetes, all of these have an underlying low-level chronic inflammatory process. And so if our bodies are primed with a low level of inflammation, the likelihood of spiking a flare is higher. So if we can diminish these comorbidities, we're diminishing the level of inflammation and the likelihood of a flare. So what is going on with MS support mechanisms? We have immunosuppressants, we have steroids. This could be dexamethasone. And the big mechanism behind dexamethasone is that it's going to modulate the inflammatory damage in an effort to reduce that disease progression or either prevent a flare or recover from a flare. We also are going to have anti-inflammatories and monoclonal antibodies. So in contemplating on MS, the one thing we really want to do is mitigate the inflammatory flares. So we want to prevent them altogether. Now, a lot of the aforementioned comorbidities are going to be pro-inflammatory. And because they are pro-inflammatory, if we can stop those comorbidities or prevent their progression, we're going to see that we can prevent the onset of flares in a lot of individuals. And as we said, with Latino Americans and African American children, they have a higher risk of low-grade inflammation compared to white peers. So again, the aspect that the body is primed for an inflammatory process. And a lot of signs and symptoms have direct inflammatory components leading to actual demyelination, which then we're going to see as on MRI. So there's a lot of different ways to mitigate these signs and symptoms. When initially thinking about the disease process, the best way to attenuate the adverse outcomes is to avert the disease altogether. When we're in medicine, the one thing we say whenever somebody comes in with a disease process is, how can we remove the offending agent? And in this case, the offending agent could be this environmental aspect, lifestyle factors that are not primed for what we're doing and how we're functioning. So the former is done by preventative efforts, and the latter by removing that offending agent and treating the underlying disease process. So as mentioned previously, it's generally understood that a lot of lifestyle factors can be used as a primary or combination intervention. So as Dr. Miravalle was saying earlier, the idea that you could take a medication and prevent a disease process is wonderful. But there's also the other side where individuals, the medication's not functioning appropriately for them. So how do we marry the idea of lifestyle factors and wellness and mindfulness with allopathic traditional care? So diet. And diet is going to be enveloping nutrients, so vitamins and minerals, as well as bioactives. So a healthy diet, like the Mediterranean diet, the MIND diet, or DASH, and MIND is the Mediterranean and DASH intervention for neurodegenerative delay, has been associated with improved cardiovascular health, diabetic glucose control, brain health, and weight loss. Also, at Rush and abroad, we've been investigating the potential role of anti-inflammatory and antioxidant properties of lifestyle modifications on several outcomes. So we are particularly focused on brain health and diet patterns, but what are those diet patterns? So the diet patterns themselves were developed because we looked at nutrients that were beneficial for brain health. We then looked at what foods contained those nutrients, so the foods and food groups. And then a pattern started to form, and that's how the MIND diet in particular was developed. So considering dietary components can act as pro and anti-inflammatory dependent upon what's consumed, diet is being investigated as one of those modifiable lifestyle factors. So if we're intaking foods that are going to be pro-inflammatory, we're going to see that that's going to elicit more flare. And if we're intaking foods that are more anti-inflammatory and antioxidant and allow for better immunomodulation, we're going to see that those are going to either prevent flares or decrease the duration of a flare. So expanding on physical activity in MS, one thing we were talking about earlier, the idea of foot drop and falls. Falls are one of those instances that lead to a lot of disability. The recovery process can be quite a long time. So whenever I talk with individuals about physical activity, it's always a matter of how do you do it safely? For a lot of us, I included, I started aqua aerobics. It is one of the most intense physical activity I've ever done. And it also removes gravity from the equation and is going to lead to less instances of injury. A lot of those low impact exercises are going to be quite beneficial. So that's going to be ellipticals, rowing, biking, things like that. Now, the one thing to keep in mind with physical activity is there's a quality and quantity aspect to it. So with our quantity, a lot of times what I like to see individuals do is about 150 minutes per week. And that's the American Heart Association's recommendation. But to delve into that a little bit more, we want to split that up. We want to do probably 5 bouts of about 30 minutes of moderate to vigorous physical activity. So it is moderate to vigorous physical activity. It's that whenever you're done, you could still talk to somebody, but you're probably going to have to breathe a little bit heavier. And if it's quite vigorous, you're probably going to have hands on your knees, pretty tired, out of breath. So really engaging that type of physical activity. And the reason being is that we're trying to optimize our cardiovascular system. So physical activity has also been found to have an association to reducing inflammatory cell production and improve neuroinflammation. So if we can have that capability to stave off or diminish inflammatory processes, we can either prevent the flare or again, diminish the duration. And as far as quality of physical activity, aerobic is where we typically sit with regards to how it's impacting overall health. But strength training has been independently associated with improved cognition. And then there's also the aspect of stretch and balance. And stretch and balance allows us to be a bit more cognizant of our bodies, but also really improve our capability to do other physical activity and prevent injury. So are other lifestyle factors that can modulate aspects of multiple sclerosis. So if obese, weight loss through diet and exercise can improve the outcomes through inflammation reduction. Again, obesity is in and of itself an inflammatory process. And again, priming that system is going to cause or lead to a higher likelihood of flares. Smoking. As Dr. Miravalle said, smoking reduction and cessation is ideal. Smoking in and of itself causes damage to the vascular system. It causes an increase in inflammatory biomarkers. So smoking in and of itself can elicit flares. Other lifestyle components. So socialization. This really gets into the idea of community. And socialization has been shown to improve our cognitive resilience, cognitive reserve, and neuroplasticity. So being engaged in just in social activities is very good. Now, what is socialization? Typically, we think of it as just being out and about and around people, which is great, but having deep-rooted relationships is even better for our cognition. And whenever we think about socialization or loneliness, you can be alone and not feel lonely. You can be in a social environment and feel lonely, or you can be not alone, feel lonely, alone, not lonely. But point being is that loneliness has a very profound impact on cognition, to the point that somebody that feels alone, it has the same impact on cognition as somebody that has had a 15-pack-year history of smoking. Now, inadequate sleep and stress can lead to low-level chronic inflammation. So sleeping. I like to lean into the 7 to 8 hours of sleep a night, but we also have to, again, take into account quantity and quality. So quantity would just be the raw number, 7 to 8 hours. Quality, what are you doing before you go to sleep? Are you watching TV? Is there screen time? Are you eating? Are you drinking? What is the sleep hygiene that gets you the best rest? And that's very important, especially when it comes to the stress biomarkers. So final thoughts on the disease. As much of the data here is either preliminary or attributed through connections to other disease processes, it can be used as potential guide for our further research. There is recognition that modifying all lifestyle factors hindering individuals is quite difficult. I have talked with individuals that want to implement one at a time, and we go over what is their low-hanging fruit. For me, diet has always been a little challenging. I was raised very meat and potatoes, and so I love meat and potatoes, but it's not the most ideal diet. So I have to be very cognizant about how I modify diet. But for me, physical activity, and instead of doing a lot of strength training, I split my time between aerobics and strength. It's not ideal, but it was low-hanging fruit for me. So what is the low-hanging fruit? What can you modify, and how easily can you start implementing these lifestyle factors? As we do with smoking cessation, understanding the motivations and where someone is with regards to readiness. So going through pre-contemplation, contemplation, having a plan, and then putting that plan into action. One thing that I talk with individuals about all the time is what happens if you fall off the wagon? What gets you back up? What's your motivation? Because there will be relapses at some point. I, for one, again, I enjoy red meat. I don't consume it all the time, but I'm going to every now and then. But I'm going to be very diligent and thoughtful about what my diet is around those meals. Now, considering the data we have is ever evolving, new data is being published each day, and new studies commence, providing the most up-to-date, pertinent, scientifically supported data to our compatriots and patients is of great import to optimize the health of our patient populations. So we really want to get into the idea of prevention, treatment, and recovery efforts. So I want to thank you for your attention. And if you have questions on specific dietary components, I would love to dive into that. But as this says, the ways in which this disease process impacts not only the person suffering, but our families is truly an aspect that keeps us very motivated towards finding better treatment options and eventually a cure. So, that questions.
Hi. Wow. What incredible, incredible presentations, Dr. Holland, Dr. Miravalle. Is it Miravalle? Is that how it's pronounced? And Kathy Keefer. Thank you. Do you think oral glutathione is beneficial for decreasing inflammation?
I have heard of glutathione being beneficial. It's not something that I've studied in particular, but I know glutathione is necessary for prevention of, say, buildup of what's called NAPQI. And especially in relation to aldehyde dehydrogenase. Glutathione is good, but again, getting your nutrients through dietary intake is best. I will say that supplements are great to bridge gaps, and sometimes supplements are absolutely necessary. So again, as Dr. Miravalle said earlier, speaking with your primary care physician about how you're going to implement these things into your routine is ideal.
I was wondering about diet.
Yes.
I know anti-inflammatory and everything, and I purchased a couple of books that said anti-inflammatory diet, but I read somewhere that eating meat was inflammatory, would cause inflammation.
Mm-hmm.
But when I bought an inflammation book, all of them had meat recipes. So I'm like, I'm not sure what I should be doing here.
Yeah, and that's a wonderful question, and diet does get very, very confusing. So when we're talking about meats in particular, there's going to be lean meats and there's going to be not lean meats. So a 70-30 burger where you're 70% protein and 30% fat, a lot of it is going to be trans fat. And that's going to be a lot more inflammatory. Whereas if you go to, I was at Trader Joe's the other day, and they had a 96-4. So 96% lean protein and 4% fat. Costco as well has quite cheap beef, and it's a 90-10 beef. Now when we're talking about meats in general, the ones to limit are going to be red meat. So that's going to be your beef and your pork. Poultry are very good, especially the lean poultry, but even better are going to be fish, but in particular, dark fatty fish, which is going to be your salmon and your tuna in particular. The reason those are so good is because they have high concentrations of omega-3 fatty acids, and the omega-3 and omega-6 fatty acids can increase your HDL. And HDL is the high density lipoprotein. It's a cholesterol, and it's the good cholesterol, quote unquote. And the reason it's good is because it can go into your vessels and actually scavenge the bad cholesterol and bring it back to the liver for processing. And it's a process called reverse cholesterol transport. Now, the bad meats, the ones that have high trans fats, are going to be pro-inflammatory. They're going to have high LDL content, and that LDL is the bad cholesterol, again, quote unquote. And that's the low density lipoprotein. And what that does is it actually goes into the vasculature and can cause the fatty streak, which then leads to a fatty plaque. And if that fatty plaque ruptures, then we have what's called an infarction or a blockage of that vessel. And that's why sometimes those meats can be inflammatory, but it depends on what you're intaking. And if I take a quick aside on microbiome, that also a huge impact on diet. So what we are consuming dictates our gut bacteria. And our gut bacteria can start modifying after about 24 hours, but it takes about a month to fully modify. The reason it's important is because that bacteria allows for the last component of digestion. So if somebody intakes a whole lot of fat and their microbiome, their gut bacteria is primed to digest that, that's fine. And then if they start intaking a salad, all of a sudden they get gas and bloating and abdominal discomfort. And all of a sudden they say, oh my gosh, I must have had bad food, or I got food poisoning. But it wasn't food poisoning. It was that their gut microbiome wasn't primed. But as you modify your diet and maintain, then your gut microbiome will modify and be able to digest those types of foods. So again, as I like to say, low and slow when you're making those modifications, and just listen to your body. I had an individual that decided to start taking olive oil, and we suggested 2 tablespoons a day. He just started taking shots of olive oil in the morning. And he said, I can't go out after noon. And I said, why not? He said, because I have to run to the bathroom and sometimes I don't make it. And I said, oh my gosh, walk me through your day. And he said, well, I wake up, I, hang out for a little bit, and then I do my 2 shots of olive oil. And I said, oh my gosh. Well, first, you've modified your diet and your gut microbiome isn't primed to digest that olive oil. Also, you're taking 2 tablespoons of olive oil in quick succession. It's oil. It lubricated his bowel. So I said, hey, go ahead and consume some whole grain bread with it and do it 3 times a day. So he was getting his whole wheat and he was minimizing his intake of olive oil at one singular time and spreading it out throughout the day. Hey, doing quite better.
Thank you.
Absolutely.
Okay, Dr. Miravalle, I'm going to combine 2 questions. Do you recommend listening to music when you experience cognitive overload? And with respect to music, another person asks, is this why I am able to move easier and walk with greater balance when music is playing versus when it is not?
Great question, both of them. Yes. So the music potentiates the benefits of exercise. And I think we all experience that. If you go to the fitness center and you try to work out, have you done that without music? It doesn't feel quite as good, right? So music potentiates. And there is a principle called entrainment, which, we entrain, our brain tries to mimic and follow the rhythm of music, the tempo. So if you're listening to music with a fast pace, most likely you're going to move faster. So yes, music and exercise potentiate each other. In terms of using music for cognition, as long as it does not interfere with the process of attention. So one of the problems in multiple sclerosis is the processing speed is decreased. So meaning the speed in which the brain processes information. If you're adding music to whatever cognitive function you're trying to practice, it might distract you. So you have to find a way in which, if you need to pay attention to something, you need to have your work done, make sure that you limit all of the distractors that could be in the environment. However, music could be also a wonderful way to practice cognitive functions. And an example that I always give, now that I moved to Chicago, I introduced one variable in my life that I didn't have in Colorado called traffic. So now I'm sitting in traffic for half hour every day or more. So what I've been doing is listen to music, and I love classical music. And an exercise that I do is I listen to a symphony, and every day I listen to the same one. But one day I pay attention to the violins. And the next day I listen to the music and I pay attention to the flute. And the next day I pay attention to the cellos. So that way you're practicing that cognitive attention that is a function that actually we all have difficulty. So you can use music to practice cognition.
So would you advise to go to a nutritionist then? Because I find all these dietary things a little bit confusing. I want a meal plan, and
I think it's wonderful to find a dietitian. Registered dietitians have the educational background in particular. Nutritionists are great, but sometimes they don't have as much of the, let's say, hard science behind the suggestions. Certainly with a lot of these diets, the Mediterranean, the MIndy diet, and DASH, their components are online. I specifically enjoy the MIndy diet. It was developed by my mentor along with the PI, the principal investigator of one of the trials that I'm on. But I like it in particular because it's easy to score. It's out of 14. And the other aspect that I really appreciated about it is it doesn't say cut things out entirely. It says to avoid or limit these foods. So red meat, for instance, no more than 4 in a week. For fried fast food, no more than once every 2 weeks, so no more than 2 a month. It's not saying that you have to cut these out entirely. And for me, I personally prescribe to the idea of I don't want to have an all or none mentality when it comes to diet, because then I will have cravings. And if I have cravings, I'm going to have kind of an unadulterated intake. So making sure that I control myself is important. I can go have a miniature Butterfinger and just do one, but it satiates me to the point that I don't have to consume an entire candy bar. But if you do find it challenging or confusing, and especially meal prep or what meals to start implementing, I think it's a really great idea to seek out a registered dietitian if you do have that capability. But do you want to talk about?
Yeah, so we are planning, as part of our initiatives for education, we will have 3 live demonstrations on cooking. And Kathy, would you like to describe the details? So Laura Morris and Jennifer Bertrelli.
Correct. So over the summer, we thought this would be a good time. We offer monthly conversations in brain health, but during the summer, we're going to do, during June, July, and August, actual cooking demonstrations with the daughter of the founder of the Mind Diet. So she will provide a little bit of upfront explanation so that you have practical ways to implement a healthy diet, the Mind Diet, and she will provide cooking demonstrations to go along with it. So that information to follow, that will be offered through Rush and is available to anybody at no cost. Yeah, and actually, we do have flyers out in the lobby on the main table when you checked in. So with the MS Yoga Moves, your table there.
I passed out flyers to everybody when you came in. So there's so much information about podcasts and the brain health program. Thank you. Incredible. Dr. Miravalle, you're going to continue talking about MS research? Oh, yeah.
Okay.
Let's give him a minute to transition.
You want to take a minute?
No, I'm fine. I'm fine. I can keep going.
Thank you.
That was amazing. Thank you so much. You don't need a breath?
No,
Everybody take a breath.
It's up to you. I'm fine to keep going.
All right, well, you're going to keep going, but just 1 minute of, you've got the slides up, all right? How about take your arms up over your head and take a big stretch? Awesome. Side bend to your right. Awesome. I know some of you are having your lunch or your snacks at home. Come on up, other way. Back to center. Hands of the heart as we say thank you to our next speaker, Dr. Miravalle.
I was shy to do it at first because I have no balance. I don't want to fall on stage. But no, that was simple enough. Thank you, Mindy. So moving on, I was asked to give you a summary of the future of MS. So we'll discuss the role of biomarkers in multiple sclerosis. I review the current approach to the use of disease-modifying therapies. We'll discuss the use of artificial intelligence in multiple sclerosis care. And then at the end, we'll review the concept of neuroplasticity, which leads to other areas like remyelination, repair, and so on and so forth. You're familiar with that already. The relapsing phase of MS early on, as you can see, the density and the frequency of relapses decreases over time, and then the progressive phase of multiple sclerosis. And what is the goal of therapy? Well, we want to decrease, if not eliminate, relapses earlier, and we want to decrease the slope of progression. And is that possible? Well, that's our goal. And now we have a name for that is called NEDA, or No Evidence of Disease Activity, which there are different versions of that. Perhaps the simplest one is what we call NEDA 3. No relapses, no disability progression, and no lesions on MRI. Of course, the more variables we add to this concept of NEDA, in a sense, the more sophisticated we can become in understanding progression that perhaps is under the surface, that has not manifested clinically yet, but that we can actually measure. And that's where the use of things like biomarkers and certain tools on MRI to allow us to understand if there is progression that perhaps is subtle enough that may not reach that clinical threshold that our patients or your providers can notice in clinic. So in terms of markers for acute inflammation, that inflammation that causes relapses, the inflammation that causes lesions, we know that some of those markers can be measured on MRI, and when we do that, we can see those active lesions. But sometimes we can also measure that in blood tests, and there is one in particular that is causing a lot of interest lately called the neurofilament light marker. And NfLs has been validated as a marker for acute inflammation, and at times we can actually see that spike of NFL prior to a new acute lesion happening. So it's an interesting area that is now becoming clinically available. We can order those tests, and we can actually look at the amount of NFL and try to use that as a way to measure or sometimes predict acute inflammation happening in the future. Similarly, markers for smoldering or chronic inflammation, that inflammation that causes clinical progression, are a little bit more challenging to measure and to understand. However, when you look at, for example, certain outcomes on MRI, we discussed before brain volume, but also looking at certain lesions. And something that we learn is that not all lesions behave the same way. There's a small proportion of lesions that slowly expand over time. Those slowly enlarging lesions, also known as cells, so SEL, those are lesions that perhaps have a different pathology, and that pathology may represent that chronic smoldering inflammation. So having tools that will allow us to measure those slowly enlarging lesions will be critical, as well as certain blood-based biomarkers like the GFAP that perhaps also may be linked to that chronic inflammatory process. So when you start adding these biomarkers, then you go from that basic NIDA, that is no lesions, no relapses, no progression, to the so-called NIDA plus, that when you start looking at these biomarkers and these MRI tools that we'll discuss. So, but, we are familiar with our medications. We are fortunate that we have a lot of disease-modifying therapies options to choose for our patients. But what are they doing? What are the benefits of these therapies? So for the most part, and I just listed the medications here in no particular order. I tried to cluster them by mechanism of action. But what are they doing? Well, they're really good, and to some degree, to affect acute inflammation. They're very good at preventing new lesions, preventing new relapses. To some degree, they may have an effect on progression and atrophy, but their benefit is particularly important early in the course of the disease. And something that we continue to learn is that time is brain, and the earlier we intervene, the better the results are going to provide to our patients. And perhaps you heard about these two different approaches: the escalation approach, meaning starting with something that is not as effective and then move on to more efficacy or higher efficacy as patients continue to progress. Well, that approach perhaps was popular back in the 90s. Now it's becoming less desirable. And that's why most of us will prefer to have more of an early intensive approach in which we hit hard early on with highly effective therapies, trying to address that acute inflammation that we know that is going to be maximal at onset. So there are different studies that has been published. This published study came from the Swedish registry, and they looked at the onset of medications, the so-called highly effective therapies, that you can see that in blue, versus the starting highly effective therapies late in the course of the disease. And this study actually looked at the gap of 2 years. So in blue, you can see patients that started highly effective therapies at early as diagnosis, and you can see that the benefits in terms of progression was substantially lower than the patients who actually delay onset of highly effective therapies. They have higher amount of disability progression. So you can see a clear benefit in starting highly effective therapies earlier, and that is a difference of 2 years. A study done in Norway looked at patients who actually started highly effective therapies as their first drug, second drug, or third drug, and they measure the likelihood of achieving neither. And you can also see that patients who actually started disease-modifying therapies of high efficacy as their first drug had a 68% chance of neither. If that was started as a second drug, dropped to 66%, and patients who started highly effective therapies as their third drug dropped to 53%. So all of these studies are telling us the same story, that if you use highly effective therapies as early as possible, the benefits are going to be higher. So there are two current studies that actually are trying to truly prove evidence to that. One is done in between the UK and the US called the LIVER study, and the other one is done at the US that is a randomized study looking at highly effective therapies compared to low efficacy therapies. All right, so moving on to the next topic, the use of artificial intelligence in multiple sclerosis. Perhaps you've read in the news, AI being used for everything in life now. So of course, we need to also be educated on AI use in MS. And perhaps the most critical area is in imaging. So here I have a picture of you showing the different evolution of lesions. So this will be what a typical acute lesion is. You have all these blue dots being the immune cells getting into the brain. In green and red, you can see the axons and the myelin. So after that acute lesion resolves, some lesions will still have some active inflammatory cells in the periphery of the lesions. So these inflammatory cells, we call them microglial cells, are thought to be the ones that cause this slow expansion of lesions. And that chronic inflammation can last up to 7 years, in which then a lesion becomes chronically inactive. So there is a lot of interest in trying to truly capture those slowly enlarging lesions as a way to understand that chronic process of inflammation that happens in the brain. So it's very difficult and challenging to truly look at those slowly enlarging lesions with a naked eye. So that's where AI may be a wonderful tool to measure the volume of lesions, and in longitudinal MRIs be able to say, okay, this lesion is growing. So that there are different tools that we can use. At Rush, we are finalizing, hopefully soon, a contract with Icometrics, being able to offer that as a tool to our patients. And this is an example of how those reports are going to look like, in which you can see that difference between the volume of lesions before and after, and truly capture those lesions that actually are slowly enlarging or expanding. This is an example of how that platform will look like. Will give us an idea of the number of lesions, but most importantly, the volume of lesions over time, as well as we can also measure brain volume. We can be able to then look at the amount of brain, the cortical brain volume, the subcortical brain volume, compare that to a normative healthy control range. So we can know there is certain percentile of loss compared to healthy aging. But most importantly, longitudinally, we can also assess for change in brain volume over time. So this is a classic example of how AI applied to imaging can help us understand a little bit more than just, are there any new lesions? But we can now start looking at, are any lesions slowly growing? What is happening with brain volume over time? So we can actually get a little bit more nuanced in helping our patients. There's also an app that comes with this program called the iCompanion app, that patients can input information on their symptoms, quality of life in between visits. So we can actually improve the ability to capture symptomatology and quality of life questionnaires. I believe they are also testing a way to measure processing speed through certain games that patients actually can complete. You know, again, going back to cognition. If we measure cognition after you came to the visit and you had to park and perhaps walk, to the visit, you're stressed and you're tired, and then we measure processing speed, may not be the right context for us to get an idea of how your brain is working. But if you do it in your house and you're rested and your stress level perhaps is lower, maybe the most representative measurement of your cognition. So I think there is a lot of value in measuring these tests outside of the busy clinic environment. So another perhaps interesting and exciting development is in the area of serum-based biomarkers. There is a platform called Octave that allow us to have access to a total of 18 different biomarkers. So this is just a blood test. And those biomarkers have been validated in understanding different processes in multiple sclerosis. And I like this slide because it reminds us of the different thresholds that we have to capture what is happening in someone with multiple sclerosis. So here on the top, you have the clinical threshold. Those are your relapses, right? We know that when someone had a relapse, there's been ongoing inflammation that has been brewing prior to that relapse. There has been inflammatory markers on blood, and perhaps it's been even MRI changes before that lesion caused symptoms. So if we are only waiting to look at relapses as a way to know if your MS is stable or not, we may be missing a lot of activity that is happening under that surface. So MRI here in the middle is helping us to look at lesions. Some of those lesions, as we discussed before, may be asymptomatic, not causing symptoms earlier. So when we do MRIs, we can capture some of that pathology that perhaps is not causing symptoms. But the exciting part of blood tests is that with certain biomarkers, we can capture inflammation that is happening prior to that inflammation causing lesions. So I think the deeper we dive, the more sensitive we can become in truly understanding what is happening in the background. So this tool will give us a total inflammation score or disease activity score, and that score is a result of levels of 18 different biomarkers. So that gives us a sense of how much inflammation is happening behind the scenes, and we can use that score in a longitudinal way to understand what is happening. Is there any concerns of perhaps inflammation in the future? This is an example of and the name of all the different biomarkers. They have been grouped into different processes, whether they represent, myelin biology or neuroaxonal integrity, neuroinflammation. So we can start understanding, what process may be happening behind the scenes. So very exciting. We can offer this test now. I believe Blue Cross is being actively negotiating to be able to cover that. So I don't want to promise anything, but I think we might hear good news that might be covered by insurance. If it is not covered by insurance, I know the company offers a sliding scale of cost that I believe the highest someone can pay is $150, I believe, for the test. For Medicare, there is no additional cost. So this is something that is very exciting to be able to offer in our clinic. Yes, sir. Right. How do you take it back to your practitioner? That's a good question. So I believe that empowering patient with information is the first step, because that might trigger that conversation back with your I think that's a great question. So moving on, I believe this is the last few slides. So I want you to leave today also with knowledge on plasticity. And before I jump there, earlier I asked you to raise your hand if you were familiar with brain reserve. Now I'm going to ask you the same thing. Raise your hand if you're familiar with neuroplasticity. Okay, I like that. So, but still there is a lot of room for improvement. So let's do the exercise at the end, and hopefully that improves. So what is plasticity? So it's the ability of the nervous system to change its activity in response to intrinsic or extrinsic stimulation. Basically, the ability of the brain to adapt to things that come from outside or things that we do from inside our body. There are different mechanisms. One is what we call neuronal regeneration or collateral sprouting. The other one is functional reorganization. But I realize that these are very heavy terms. So what I thought to do today to you is Make it simple so we can all understand and apply. And for a moment, I want you to think that your brain is like a big company, and each cell or each neuron is like an employee. So let's imagine that your brain is like a law firm, and your brain has 300 employees, and everyone is working well, and everyone was doing great, and then COVID hit. And that company had to reduce their workforce. And all of a sudden, from 300 employees, it went to 200 employees. So imagine now that the brain was doing great, and then MS hit. And it caused some atrophy. And you went from having X number of cells to a reduced number of cells. So what are the things that that law firm is going to do? All of a sudden, you have 300 employees and you went to 200. How can you make that law firm continue to function despite having less people? Just give me ideas, examples. Make them work harder. And we talked about that before with MS, right? We saw functional MRIs that those neurons were working harder, right? What else? I'm sorry? Let somebody go. Yes, they did already. They went from 300 now to 200. So how do you make these 200 employees that are now in the workforce do the same thing and function at the same level? Give them more roles of responsibilities. Excellent. Train them. Very good. Give them more money, more motivation. Excellent. How about create more employees? Right? So use more tools or bring more employees to the table. That's what the brain is doing. The first thing the brain is going to try to do is create more neurons. If I have a reduction number of neurons, can we build more neurons? That's something we call neurogenesis. We kind of talked about that before. There are certain parts of the brain that can be induced neurogenesis. Not every part of the central nervous system, but particularly those memory cells in the hippocampus that you can stimulate that. So one of the things we know is in MS, the use of exercise, particularly exercise, is one of the most profound ways to improve neurogenesis. But also mindfulness, meditation, those are ways actually have been proven to improve neurogenesis and help consolidate more memories. So those are different things that actually are showing a benefit in neurogenesis. But let's go back to the example. So you went from 300 employees to 200 employees. Well, somebody says, train them, improve efficiency. So improve communication with the current employees. So you can't bring more people. You have to function with the 200 employees. So let's make that communication more efficient. And the brain is doing the same thing. And that's what we call synaptic plasticity. So in multiple sclerosis, if you train those cells to be more efficient, you can take advantage of this mechanism that everyone has, and MS is not taken away from you. So let's review how neurons talk. So here we have one neuron, axon, dendrites, talks to the next neuron. In MS, what could happen is that lesion interrupts the communication between these two neurons. So two things can happen. One is what we call compensatory sprouting. What that means is that this cell now has to communicate with this cell that has that interruption from the previous neuron. The other one that could happen is regeneration. You can regenerate that pathway between the two. So it's been proven in multiple sclerosis that synaptic plasticity can be positively influenced by exercise, environment, repetition, motivation, and neuromodulation. And this brings us to Physiology 101. So today you're learning about anatomy, you're learning about neurology, and now you're going to learn about physiology. So going back to how the two neurons talk. So in the middle, that's your normal synapse. You have one neuron talking to the next neuron. They send these neurotransmitters, and they're going to affect the next neuron by entering through this channel. That's normal. That happens to all of us. And imagine that this is happening when we exercise. So as I'm walking, this neuron talks to the next one by sending these neurotransmitters. But let's say I want to run, and I want to exercise, and I want to improve that function over and over and over, and I want to challenge the system. So all of a sudden, you're going to find that in this synaptic cleft, the amount of neurotransmitters is going to increase. because the density and the amount of activity is increasing. Are you following me? Okay. So what do you think is going to happen to this neuron? All of a sudden you have more chemicals coming to your door. What do you need to do? You need to open more doors so they can get in, right? So what is going to happen is that the amount of receptors is going to increase. So one of the normal compensatory mechanisms that we have in the brain to respond to increased activity is an upregulation of the receptors in the postsynaptic neuron. So when we are exercising and we are getting better at something, we are actually making changes in the postsynaptic neuron to increase the amount of receptors to be able to tolerate that extra amount of exercise and activity in the neurons. Conversely, have you heard the word, if you don't use it, you lose it? Okay. Well, if you don't use it, you lose it is the way to explain what we call long-term depression. Meaning, if you don't use certain pathways, these neurons are going to say, hey, I haven't had this chemical stimulation for a long time. I'm going to become lazy and I'm going to downregulate my receptors. I don't need them. So if you don't use certain functions, the neurons, those pathways in the brain are going to say, well, maybe if they don't use them, that means that they don't need it. I'm going to just rewire and do something else. So this explains how this system is constantly being influenced by what we choose to do. And the things that we do more, the system is going to get better. And this process does not get affected by your multiple sclerosis. So what I'm trying to say is that if you have a function that you want to improve, you need to do it. You need to use it, and you need to challenge that function. And if you don't know how to do that, that's when you ask for help. Whether it's a physical therapist, if that function includes movement, whether it's an occupational therapist or a neuropsychologist, if that function involves cognitive skills. And the last example I have for you is that going back to the law firm, you have now 200 employees. You need to reorganize them. You need to retrain them. And that's what we call functional recovery. And that's something that perhaps you're familiar with. And we know that through physical therapy, rehabilitation, but things that perhaps you haven't heard before, mindfulness and meditation is related to long-lasting changes in hippocampal functional topology in resting state. And that was a study done in multiple sclerosis. And last but not least, musical training, neuroplasticity, and cognition is a great article that look at how through music therapy you can reorganize and retrain those neurons in the brain. So I believe I have a few more minutes left. Talk about remyelination. Nothing new. We are still trying to find that medication that will help us remyelinate. Some of the positive trials are listed here in neuroprotection. More to come in terms of simvastatin. There are a few studies done in the UK and in the US to try to see if high-dose simvastatin can be helpful for neuroprotection. We heard about BTK inhibitors. The first clinical trial, unfortunately, did not show any beneficial effects compared to teriflunomide. There are a few other studies on the BTK area. I've just listed them all here. That we are waiting to see if there is any benefit. If you're not familiar with BTK, that's a different way to affect B cells, but also theoretically has an effect in microglial cells that are those cells in the CNS, in the brain, that are perhaps helping to expand those slowly enlarging lesions. So a lot of interesting science behind BTK inhibitors. Unfortunately, the first study did not show any significant benefit, but I think we are all hopeful and still have some cautious optimism for perhaps the other medications that are currently being tested. And there is always a question about stem cells. So this is just to give you a summary of the research that has been published, data on autologous stem cell transplantation. And you can see that some have shown some beneficial effects when it comes to proportion of NIDA. The errors and the confidence interval is pretty wide. So nothing has shown so far to be better than what we currently have available, but there are some studies that actually are looking into that. I just listed these two studies, one in the UK, one in the US, that are currently looking at autologous stem cell transplantation in patients with multiple sclerosis. And with that, I would like to end. Thank you for your attention.
Thank you again. I have one online question, and then we'll go to our audience here. I'm going to come back there in 1 second. Okay. I'm trying to interpret this question. She or he were talking about the brain reserves, and do lesions in the spinal cord also affect brain reserves?
That's a great question. So the spinal cord is a place where all the pathways to and from the brain will converge. So there is little, if any, brain reserve, as to speak. The brain reserve, by definition, is in the brain, not in the spinal cord. However, there might be some room for compensation that could happen even with spinal cord lesions. So if you look at the amount of redundancy and reserve, the place that has maximal reserve is what we call the supratentorial part of the brain, meaning the upper part of the brain. As you get closer to the brainstem and the spinal cord, the amount of reserve decreases. That doesn't mean necessarily that it's not possible to recover from lesions in the spinal cord.
Hi. I actually have been on Crevas for about 5-6 years, and I'm just wondering, I didn't see anything about that. Is it actually helping me?
So, I didn't go there for a particular reason, right? So it's very difficult to make statements that apply to one patient in large group. However, what I can answer to that question is ocrelizumab, and now we have different type of anti-B cell therapies. They have proven efficacy in markers of acute inflammation, in relapses, in lesions, as well as progression. So we usually use this data from large phase 3 trials to establish a sense of, how good are these medications, right? So it's considered one of those highly effective therapies, and that's based on clinical trial data. Why it's not helping you, that's something I can't answer here. But I will say, I think something that important that comes from that question is all of you need to have an honest discussion with your provider every time you see them, saying, how do I know this medication is helping? How can I measure that? And if there are any areas that you feel are not being addressed, address them during the visit.
If a patient can reverse the neurological reserve, does that mean that you can reverse disability as well?
So no, right? So it's not linear. So yes, you can stimulate reserve by all the things that we talked today. Is that necessarily going to translate that for improved function? Not necessarily. We hoped yes. And there are certain functions that may be easier to restore. But unfortunately, there's also circumstances in which function has been lost, and there are some strategies may not help to restore that function. However, the idea of introducing lifestyle interventions to promote helping brain reserve has the intention to make the brain as healthy as possible, as resilient as possible, and as prepared as possible to compensate for any future pathological insult. Yes. Absolutely.
Can you repeat what she just said,
Yeah, so
please?
that's a great point. So basically, what she's saying is that we are also aging, right? So engaging into these lifestyle interventions is going to help us age in a healthier way. And to your point, I think, particularly if you have a disease that you know that is affecting the brain, well, do everything you can to make the brain the healthier you can, so you're better prepared. And that can also help you function in life the way you want. So sometimes functional recovery, it's not possible, but that doesn't mean that these interventions are not helpful.
Thank you again for a fabulous presentation. We appreciate you and your time. Thank you.
Thank you.
MIndy, are you going? All yours.
Just get you moving for a second between speakers here. Everybody take your hands up, spread your fingers, bring your thumb on the inside, wrap your fingers around, and circle your wrists. Awesome. And breathe. Take an inhale and an exhale. Reverse the circle. And then shake out your hands. And let that go. Let's circle the shoulders. You deserve a little shoulder massage. Take your shoulders up, back, and around. And we are on to our next speaker, Lori.
Wonderful. Next, we are pleased to present Mitra Rouhani. Mitra is a physical therapist in the Exercise and Rehabilitation Science program at Marquette University in Milwaukee. Her research is focused on chronic disease management in neurologic populations, in particular MS. Currently, she is investigating the extent and impacts of neuromuscular fatigue and pain in people with MS. Her long-term career goal is to become an independent investigator conducting translational and implementational research focused on strategies that directly enhance the quality of life for people living with MS. Mitra recently successfully defended her PhD program to receive her PhD degree. Congratulations. Mitra will speak today on photobiomodulation therapy or light therapy. Welcome, Mitra.
Hello, everyone. My name is Mitra, and thank you to Lori, MIndy. It's truly an honor to be here today to talk to you about photobiomodulation therapy in individuals with multiple sclerosis. I'm going to begin my talk by providing some context about myself. I'm a PT. I worked as a clinician for almost 4 years before starting my PhD program back in 2018. In clinical settings, translating clinical knowledge into practice isn't always straightforward. This challenge sparked my interest in research, which was further developed during my PhD program at Marquette University in Milwaukee. During the PhD, my research was focused on chronic disease management in people with MS, aiming to enhance our understanding of disease mechanisms and address some of the challenges that individuals with MS encounter daily. One of the research studies that I conducted during my PhD focused on photobiomodulation therapy, or in short form PBMT, in people with MS, a topic that I'm excited to discuss with you all today. Today, I will guide you through the definition of PBMT, discuss the parameters and application, provide an overview of the PBMT devices and how PBMT affects cellular function. My goal for this presentation is to provide you with 2 key takeaways: whether PBMT is effective for individuals with MS, and whether it's a one-type-fits-all type of treatment. Is anybody here familiar with a PBMT? Raise your hand if you've ever heard of it. Okay, good, a few people. So, if you've seen a Star Trek on TV, it's likely that you have seen it. You know, on a Star Trek, when somebody gets injured, they get taken to sickbay. The doctor gets out a laser beam, aims it at the injury, and the patient is healed instantly. Well, this is PBMT. Now let's take a look at the word PBMT. At the word photobiomodulation. Photo means light, bio means cell, and modulations means a stimulation or inhibition. Photobiomodulation therapy is a form of light therapy that can stimulate or inhibit the function of the cell. It's not instant like on TV, but you get the idea. You shine the light on an injured part of body and it gets better. There are different names for PBMT. You may have heard of it as red light therapy, low-level laser therapy, soft laser, cold laser. They are all referring to the same thing, which is photobiomodulation. This treatment has been around since 1967. It's been found by Professor Mitra from Budapest. He's known as the father of PBMT worldwide. The story of how he discovered the benefits of PBMT is really interesting. In 1967, a few years after the first working laser was invented, he started the experiment on the effect of laser on skin cancer. He wanted to find out if laser might cause cancer in mice. He took a group of mice, shaved the hair off their back, and divided them into two groups. He gave the laser treatment to one group, and the other group remained untreated. After the course of treatment, the treated group did not get cancer. Surprisingly, the hair on the treated group grew back faster than the untreated group. He soon applied his findings to human patients, and he was able to discover all the benefits of PBMT, which we'll go over shortly. From the scientific perspective, PBMT is defined as the non-invasive application of monochromatic light, which is the light of one color, in this case red and near infrared, for the purpose of biostimulation. The source of light is a laser or diodes. This light has specific characteristics. The most commonly used wavelengths in PBMT range from 600 to 1100 nanometer. These wavelengths are chosen because they are known to penetrate tissue effectively and stimulate cellular processes that are associated with healing and pain relief. Now, you may think that lasers in medicine are all dangerous and they are all for cutting and burning things. The good news is that not all lasers are dangerous. In fact, some of them are less dangerous than the others. And that is because there is different classes of lasers, ranging from class 1, the laser that you see in supermarkets, to class 4, the super high-powered surgical lasers. PBMT is class 3B. These lasers are usually safe for the skin, but they can be harmful to eyes. So you don't want to stare at them, and you want to use laser safety goggles that usually come with these devices. The effectiveness of PBMT depends on specific parameters, utilizing the correct wavelengths, intensity, precise application to the targeted area, and appropriate duration and intervals are crucial. When these parameters align, they induce various positive effects, including tissue repair by increasing the speed and quality of healing. It can reduce inflammation, reduce swelling and edema, and it can also cause pain relief. Here are some examples of the clinical application of PBMT. In clinics, it can be used for different types of tendinopathies, for painful joints, neck pain, side effects from chemotherapy, such as oral mucositis. different types of neuropathic pain, such as carpal tunnel syndrome or trigeminal neuralgia. It can be used for wound healing, such as diabetic wounds, lymphedema, hair loss, and it can be used right after orthodontics to speed up the movement of teeth and for pain relief. We talked about all the benefits of PBMT. It almost feels like it's too good to be true, right? So let's understand how PBMT affects the cell. It's important to know that it's not a heat therapy. The effect of PBMT is photochemical. It's very similar to photosynthesis in plants. But instead of producing energy for plants, it generates energy at the cellular level inside a component called mitochondria, which is this greenish component over here. For those of you who may not be familiar with mitochondria, our body is made of organs, and our organs are made of cells. There are millions and millions of cells in our body doing different things. But there is one thing that they all have in common, and that is they all have a component called mitochondria, which is the powerhouse of the cell. Mitochondria combines the food that we eat, the air that we breathe, and convert it into the energy for the cell inside a molecule called ATP. Under certain circumstances, like when the cell is damaged or under stress, mitochondria cannot function properly, so there is not enough energy available for the cell. Now, by the application of PBMT, when the light penetrates the tissue, this light gets absorbed by mitochondria. And this triggers a series of downstream effects that ultimately improve mitochondrial function. So now there is more energy available for the cell. It can also cause vasodilation, and it can promote the expression of genes and proteins that can inhibit cell death. It can also affect different tissues and organs in our body. It can increase local blood circulation, so it can improve inflammation, and it can relieve pain that's associated with degenerative diseases and different types of injuries. It can also promote the healing of different types of wounds, and it can stimulate the healing of deeper structures such as neurons, bone, joints, and more importantly, for the purpose of our talk today, muscles. Before diving deeper into the impact of PBMT on muscular function, I'd like to show you some examples of PBMT devices and also give you a brief demonstration of how PBMT impacts, how we apply PBMT. Although I forgot to bring my case. Yeah, if you can help me with that, Lori. PBMT comes in various shapes, and that depends on the intended application of the device and the manufacturing process. Thank you. This device can be in a flexible shape to go around the shoulders to go around the joints like the shoulder joints. There are portable devices to be used on remote joints. They can also be used on pets for relieving pain. They can also come in the shape of a cap with the red light planted inside this cap, and it can be used for hair growth. This picture shows an example of the PBMT device. Here I have this device with me just to show you the application of this device. And this is the device that we use in our research at Marquette University when we were investigating the impact of PBMT on muscular function. This is from the Multi-Radiance Medical Company, which is a laser company. And this device is basically designed to relieve pain and increase local blood circulation. It's a lightweight device. You can use it at home. The way that we applied this device in our research was that you want to use laser safety goggles, both the patients that's applying the device and the patients that receiving the treatment. And then we hold this device in close contact to the skin. There are different modes on the device, which indicates different intensities. It can go from mild intensity, which is the low intensity, all the way to higher intensity, which delivers more energy into the tissue. And there is a built-in timer in this device. Based on the amount of energy that you are using, the duration of treatment gonna be different. With this device, the duration goes anywhere from 5 minutes to 15 minutes. Several clinical studies investigated the impact of PBMT on muscular function in non-disease populations and in athletes. Here I have a few of these studies on the screen. Altogether, the finding of these studies showed that PBMT is able to improve muscle fatigue and improve muscle force recovery in non-disease populations. With the substantial evidence supporting the impact of PBMT on muscular function, coupled with the prevalence of muscle weakness and muscle fatigue in people with MS, we were intrigued to investigate the impact of PBMT on muscular function, potentially by improving mitochondrial function in people with MS. In a research study managed by Dr. Alexander Ng from Marquette University in Milwaukee and Dr. Jerry Ann Lyons from University of Wisconsin in Milwaukee, we investigated the acute and extended effects of PBMT on muscular function in people with mild to moderate MS. In order to investigate the acute effects of PBMT on muscular function, we recruited 17 individuals with multiple sclerosis, 3 males and 14 females with mild to moderate MS. The way that we performed the study, here we have a picture on the top right. We asked participants to perform a brief exercise with the tibialis anterior muscle, which is a tiny muscle located in front of the shin bone, and this muscle is responsible for pulling foot toward yourself. So we asked participants to perform the brief exercise, then the PBMT was applied in between, and the exercise was repeated after the application of PBMT. Here we used 3 different doses of PBMT, a low dose, medium dose, and high dose, because we did not know which dose of PBMT would be more effective. And we compared the effect of these active doses to a sham device. Here is a figure of our results. Here we are comparing the results from 3 active doses to the sham device. And we wanted to see under which dose people are able to recover strength back to their initial strength. So we were looking for full force recovery. And what we found in this study was that under the high dose PBMT, almost all participants were able to recover strength back to their initial level. So it showed us that a high dose of PBMT might be effective in improving muscle force recovery. Another finding from this study was that under the low dose and medium dose of PBMT, some participants were able to achieve full recovery. So this showed us that the optimal parameters of PBMT might be specific to each individual. For the second part of this study, we investigated the extended effect of PBMT on muscular function. This time, we measured the muscle performance. Then we sent participants home with the device and we asked them to treat the belly of the tibialis anterior muscle daily for 2 weeks. Then participants would come back to the lab and we would reassess the performance of the muscle. And we compared this to the result of the sham treatment for 2 weeks. What we found here was that under the active dose of PBMT, individuals with MS, in fact, gained strength after the 2 weeks of treatment. Another finding from this study was that under the active dose of PBMT, the functional endurance improved in individuals. The way that we measured functional endurance was by using a test called the 2-minute walk test. This is a clinical test to measure functional endurance. In this test, we ask participants to walk as fast as they can during the 2 minutes, and we would measure the distance that participant is able to walk. So what we found here was that after the 2 weeks of treatment with the PBMT, people with MS were able to cover longer distance compared to what we measured before treatment. To give you a summary of our research, there are evidence of the prevalence of muscle weakness and muscle fatigue in people with MS. And there is also evidence of the effectiveness of PBMT for improving muscular function in non-disease population. So we hypothesize that PBMT may improve muscular function in people with MS. Our findings suggested that an individualized dose of PBMT may improve muscle force recovery and baseline strength in people with mild to moderate MS. So here we have 2 questions, and hopefully most of you here would be able to answer these questions now. Is PBMT effective for individuals with MS? What do you think? Yes. So based on our finding, it seems like that PBMT could be a novel therapeutic modality to be used independently or in conjunction with other treatments such as exercise to improve muscular function in people with MS. Is this a one-size-fits-all type of treatment? No. Further research is needed to find the optimal parameters to be used in PBMT and to figure out who would benefit more from using PBMT. At the end, I'd like to acknowledge the PIs, the principal investigators of this study, Dr. Alexander Ng and Dr. Jerry Lyons, also Dr. Miguel Tolentino and Dr. Crisco. I'd like to thank National MS Society and the Multi-Radiance Medical, and also a huge thanks to all the participants of the study who made this research possible. I'd be happy to take any questions now.
Thank you for a very informative talk. We appreciate it.
Of course.
Any questions? We have a question here.
Okay. For this treatment, would it be best to just do it on the affected areas, or can you put it directly on your lesions? Like, you know your lesions are in your spine. Can you put it on that, or should it be on your legs if that's where it's affected?
Can you repeat that question?
Of course. So the question was, if you want to apply the device directly on the area that you think is affected, or you want to apply it on the lesion. So the answer to this question is you want to apply the device on the area that's affected. Now, it's important that what is the intended application? Why are you using this device? Is it to relieve pain? Then that's whole another story, because pain is a very complex issue in MS. It's usually not localized. So usually it's really hard to find the area. But if it's a localized pain, then with consultation with your primary care physician, you can use the device on locally on that area that's affected. And if it's a painful joint, yes, for sure, we can apply it on the area.
Do you think it would help with spasticity?
Right. So the question is if PBMT gonna help with the spasticity. To the best of my knowledge, there is no research being done on the effect of PBMT on spasticity. So we know that PBMT gonna improve muscular function in terms of gaining strength, so it's going to improve baseline strength. But at this point, we don't know if it's also able to improve spasticity. That would be something that hopefully with further research, we would be able to find what PBMT is most effective for.
Thank you. And does this program, is that covered by insurance?
That's a great question. So the question was if PBMT is covered by insurance. I don't think that is covered by insurance. I know that in some PT clinics now, they offer PBMT. They offer it for, I think, about 10 sessions of treatment. But no, I don't think that is covered by insurance, unfortunately.
I bought one of those devices on Amazon. And can you tell me what voltage we should be using if we could do that?
So the question is what voltage, what parameters should be used with the PBMT device? Well, the answer is ultimately the parameters gonna be determined by the clinical knowledge or by the manufacturer. So it depends on the type of device that you would purchase. There are some recommendations on the type of wavelengths, the intensity, the duration that you need to use with the device. For sure, you want to speak to your primary care physician in order to find the right parameters that would work for your condition. It also depends on the condition that you are using the PBMT for.
Thank you.
Of course.
Thank you so much. Such a new topic, right? We haven't often heard that. And Dr. Rouhani just completed her dissertation, right? Now you're Dr. Rouhani. Yay! All right, it's my pleasure and honor to bring up Dr. Bhupendra Khatri. And I gotta tell you, we had to do some negotiation to get him here. He drove all the way. Was it a 2-hour drive for you? So many of you might be familiar with him. He's pretty famous. He's a neurologist and the medical director of the Regional Multiple Sclerosis Center in Milwaukee, Wisconsin. He is the author of Healing the Soul, Unexpected Stories of Courage, Hope, and the Power of Mind. I saw someone in person with their book and wants it signed by you. Don't leave without that. Dr. Khatri completed his medical education at Grant Medical College, University of Mumbai in 1974. He then finished his residency at the Medical College of Wisconsin and Sir G Group, is it JJ or G Group of Teaching Hospital. Dr. Bhupendra is the esteemed founding medical director of one of the country's largest MS centers. He's got quite a fan club there, recognized for his exceptional care and groundbreaking research in multiple sclerosis. His commitment to excellence has earned him recognition as a top doctor by Milwaukee Magazine and various prestigious awards. Dr. Khatri specializes in treating myasthenia gravis, multiple sclerosis, infusion therapy, and plasmapheresis treatments. Dr. Khatri's expertise is highly sought after. He's also garnered attention as a renowned speaker, delivering lectures nationally and internationally on topics such as MS, neurological disorders, the power of the subconscious mind, and positive thinking. Currently, Dr. Bhupendra practices at the Center for Neurological Disorders, where he and his team prioritize patient convenience by offering flexible appointment scheduling. Dr. Khatri will speak to us today on healing the soul, finding hope and courage in life with MS. We welcome Dr. Khatri and thank him for traveling here from Milwaukee.
Thank you so much. And hello, everyone. Good afternoon. I'm really excited to be here today. And I want to thank MIndy and the Yoga Moves MS organizers for inviting me here today. So MS is a lifelong disease. We have no cure. But even though it is one of the most disabling leading cause of disability in this country, we have come a long ways. We now have highly effective therapies that can practically shut down the clinical and MRI relapses. But we cannot clap with one hand, right? Try to clap with one hand. I don't think you'll make the noise, right? So that's where you come in. You as patients, even though we can give you the most effective therapies, but if you don't take care of yourself, if you don't eat right, if you don't exercise, if you don't think positively, and if you don't think that things can happen, you cannot heal from within. And I think I am really excited that all of you are here, committed, and came here to learn so that you could be a good advocate for yourself. So let's give yourself a big round of applause. Come on, let's give you more, louder. That's great. Thank you very much. So let me share a story of Chris. Chris is my patient with multiple sclerosis. And by the way, all the pictures and videos that I'm going to show you today, I have the approval from my patients to share it with you for educational purposes. So Chris has the most severe form of MS. Despite being on interferon, she was getting frequent relapses, frequent IV steroids. It got to the point where walking from one end of the room to the other was a chore. At that time, we were invited to participate in a clinical trial, a double-blind, placebo-controlled trial of Tysabri. And we asked Chris, will you participate? And she said yes. So she started getting infusions every month. MS trials are 2 years. 1 year into the trial, she was so much better that she could trek down the Grand Canyon with a 45-pound backpack. She started running. She would run about 3 miles. Over the weekend, she would go bicycling. She would bicycle about 150 miles. And then the unthinkable happened. The drug was pulled off the market because there were 3 patients who died of PML. And Chris was devastated. She did not know what to do. So she's in the legal profession. She wrote to Biogen saying, I will never sue you, please give me the drug. And Biogen, of course, would not do that. So she went to the press thinking that the public pressure might help. In the morning, I open up the newspaper and there's a big photo of Chris with a backpack. And the caption said, the drug that gave her life is now pulled away from her. That afternoon, we break the code, and Chris was on placebo all the time. She was not getting the real drug. And I called Chris And I say, Chris, I want you to know that you are getting placebo all the time. And Chris is very intelligent. She said, Dr. Khatri, that's the power of positive thinking. She never doubted that she was getting the placebo. She knew that she was getting the real drug. That's all she thought about. And Chris was able to convert a placebo into a powerful therapeutic tool just with her positive thinking. So if you pause for a moment and think, if she could do that with the positive thinking, what about the negative thinking? And I'm going to share with you a video. Focus on my finger. Okay, let me put this on a hold for a second, but let me tell you, this is a patient who had been diagnosed with multiple sclerosis. She was wheelchair bound for 3 years. She was blind in both the eyes for a year and a half. She had an indwelling Foley catheter, and she was referred to me because she had a lot of spasms in her legs. And the doctor wanted me to consider her for intrathecal baclofen pump. When she came to see me, I examined her, and something was not sitting right with me. And I said, Sandra, when was your last MRI? And she said, I never had MRIs. And I said, well, how were you diagnosed? And she said that she went to see the doctor when she had some numbness on one side of her body. And the family doctor said, you are young, you're in Wisconsin, you're Caucasian, most likely you have MS, and I'm going to refer you to a neurologist. And she was so convinced at that time that she had MS, that she said, I don't need to see anybody, I'm going to take care of this. She read up everything the MS patient could have, and she developed the blindness, the bladder issues, the spasticity. So we got the MRIs, and the MRIs were all normal. So I told Sandra, I said, Sandra, I have good news for you. You don't have MS. What you have is a mental block, an energy block. And if you like, we can undo that and you'll be fine. And she said, sure. So I asked her to take a video, and what you're going to see is her exam before and then after we undo the mental block. So if we can go back to that video. Focus on my finger.
I'm doing the best I can.
I know. Can you see my finger at all?
No.
No, okay, and she can't see that at all. Can you see the light at all or no?
Just vaguely.
Vaguely. Is it on or on? Off?
It's off.
It's off, okay. All right. And she can't see the light at all. And she's getting the spasms in the legs. What's going to happen? She's going to start seeing the light first, then she'll be able to read too. Can we see you walk a little bit? So we undo the energy block.
Always fall to one side.
And I'll tell you how we did that.
One finger?
Okay. Great. That's great. That's beautiful. Break that.
Francis?
Yeah, right. Just read the first sentence and then we'll come where you were supposed to be next.
3 Arkansas Travelers A. Something about a president.
Okay, go ahead. Read it. Let's take a walk. Stay by yourself. And that's the second try. And it'll be a little bit better than the last time. You can see the improvement there. Okay, now watch out, there's a wire here. Okay, good.
Okay, spin around. Good. Great. Let's go back.
Dr. Khatri.
All right, let's go back there.
So she had not stood up for 3 years. She was in a wheelchair. Now, what we did was, she was convinced. She put those negative thoughts to her brain that she's going to develop all these problems that MS patients can. And as soon as you put those thoughts, your subconscious mind takes it and it goes to work and you develop all of those problems. So she's not doing this intentionally. The subconscious mind has gotten her to this state. And what I did was simply, I just did whatever I could have done. I just massaged her neck and I said, look, I'm undoing the energy block. And I just did that for about 1 minute. And she was able to start reading. And she was able to walk. So this is the power of your negative thought. Let me give you an example of another one. So let me put this on hold and tell you a little bit about this patient. So this patient was working at a factory. And while she was working, she collapsed. She developed a left-sided weakness. So they rushed her to the emergency room locally. They diagnosed her as having a stroke. They called our center in Milwaukee, and she was flown. She came to the emergency room. They got the CT scan, which was okay, so they gave her TPA, which is the thrombolytic treatment that they give to undo the clot. And she was hospitalized. The following morning, I was asked to see her. And when I saw her, her exam, again, didn't look very, it was something about the exam that just didn't make me very comfortable. So I said, well, let's get another MRI. And the MRI was normal. If she has had a stroke, the MRI would have picked it up. So I told her, I said, you know what? The good news is that you don't have stroke. You have energy block. And let's undo the energy block and see how you do. So you're going to see this video now.
And you've been paralyzed on this left upper extremity for how long now?
Since Thursday.
And it started real suddenly. You were at work and then it started to get tingling and then it got paralyzed, right?
Right.
And then you had a bad headache afterwards.
Mhm.
How has it been since that time, since last Thursday?
No feelings in the arm, face, neck, shoulder, and very severe headaches.
Okay. And have you been able to move your left arm?
No, not at
Okay,
all.
all right. Can you hold your arm like that? Hold it up like a super woman. You push me away. Squeeze. Good. Okay. Now, can you move this arm at all? At all? Anything?
No.
Okay. All right. So, John, what I'm going to do is I want you have you coming. Just stop there for a second. Now, I'm going to move this and I'm going to lift this arm. Now, let's see first. Can you move your fingers at all? Okay. Try. That's all you can do?
Yeah.
Okay. Okay. All right. Now move your fingers. You can make a fist. Good. Okay. I'm going to lift your arm a little bit more and you'll increase the movements there. Okay, there you go. Now spread your fingers. Spread like this. There you go. Now spread them apart like this. See? There you go. Okay, spread them apart. Make a fist. Real tight, like this. There you go. Okay, hold it up. Now touch your nose. Go ahead, touch your nose. There you go. Good. Now touch my finger. And touch your nose. Okay. Keep doing it real faster. That will be much easier that way. Faster. Keep doing it.
So this patient, her elder sister had suffered a stroke. And she was concerned that she's going to have a stroke. And she kept thinking about it. Her subconscious mind took it and it fed into the brain. The subconscious mind then went to work and she developed what we call a stroke. And we were able to, by just undoing the energy block, get her back to normal within about like 4 minutes. So the power of positive suggestions as well as negative can have profound effect on how you do, how you function. If you put in positive thoughts like Chris did, you can have a positive outcome. If you have a negative thoughts, then you're going to have a negative outcome as well, and can influence the healing in overall. So the question is, if I have a patient with a real illness, can I, as a healthcare provider, cause him to think positively? Can I have his subconscious mind start to think positively so that we can have an effect on his terminal illness? And at that time, when I was asking those questions, I was called to see a 76-year-old, very frail man who had difficulty swallowing, difficulty chewing, difficulty breathing, had lost a lot of weight. And I was able to diagnose him with myasthenia gravis. But he also had a big tumor in the chest, a tumor of the thymus gland, thymoma. And so the surgeon went in and he removed as much tumor as he could. It was a stage 4 cancer of the tumor gland. And he said that he probably needs some radiation and chemotherapy. But he was so frail that the oncologist said that if he put him on any chemotherapy, he's going to die. He's not going to be able to tolerate. But he wanted it. His family wanted it, so he underwent the chemotherapy. And he got so sick. He was the sickest person that you'll ever see in an ICU. His white cell count dropped to 0. He was septic, febrile, bleeding in the gut. He had C. diff from the antibiotics. But my PA and I will go to every day to him, twice a day, and tell him, Bob, you're going to get better. You're going to get better. Your chest x-ray is looking better. Your blood counts are beginning to look better. But you're going to get better. Now, he had immigrated from Greece when he was young. And I told him that, Bob, when you get better, we're going to have ouzo together. We'll have a party. And we kept telling him. He walked out of the ICU 2.5 months later. And he was going to come and see me in the clinic. And I was going to buy him a bottle of ouzo, and I totally forgot. So he and his wife came. And I said, Bob, you look great. After the exam, I got up and I said, I'll see you in 3 months. And he got off my hand and said, sit down, Dr. Khatri. He pulled out a brown bag and he pulled a bottle of ouzo out. And so I called my PA, and we had 4 glasses, and for the first time we had a little bit of a shot in the clinic. But I asked Bob, I said, Bob, do you remember us telling you that you're going to get better? And he says, yeah, you kept telling me. And he said, pointed to John, my PA, and he says, John kept telling me you're going to get better. I said, did you believe us? And he says, no, you were bullshitting me. But then he said, after you left, God came to him and whispered in his ears. And he says, I'm going to put strength in Dr. Khatri. He is going to make you better. He's going to heal you. And that's when things changed. When he really believed internally that he's going to get better, that he started to improve. And that's very important. Just simply saying, I'm going to have positive thoughts, it's going to get better? No. You have to believe in it. You really have to. You have to visualize it. And that's what happened with Bob. And I'm going to share, I took a video, but I'm going to share a little bit of the video that we took when he came to see me in the clinic.
I prayed and prayed and prayed and prayed. Always I prayed. Finally, and finally I find out, all of a sudden, that get better. But all my doctors, Dr. Khatri, Dr. Rudy, the other doctor says, you get better. Little John here, little John's come all the time, says, Bob, you're gonna be better, you better, you look better, you are better, you get better. Come on, John. One time I said to John,
I'm gonna
come on,
die.
John, you don't know what you're talking about. I said to John.
So he didn't believe us until God came to him and whispered in his ears that all the doctors taking care of you are going to make you better. And that's important. You know, as soon as you accept an idea consciously, it fits into your subconscious mind and it begins to execute it right away. And it can be positive or negative. So this is Hippocrates, who is the father of medicine. You know, we take the Hippocratic oath when we graduate from the medical school, and he said, I would rather know what sort of person has a disease rather than what sort of a disease a person has. So it's very, very important what you're thinking. What's the patient thinking? What is the patient's character? It is so important for you to believe in yourself, to believe that you can make things better. And that's what he said, is that it's the character that's important. What you're made of, what you're thinking is important, rather than what disease you have. And these are the two giants. You know, on your left is Louis Pasteur, who is sort of the father of modern immunology. And on your right is Claude Bernard, who, in fact, suggested that we should have double-blind control studies. He was the first one to suggest that. And both of them, more than 2,000 years after Hippocrates said that, came to the same conclusion, that what you are, it's the important factor in the disease is not the germ or what's causing the problem. It is what you are made of. What is your body is made of? What are you thinking? And that is very, very important. So this is Bernie Siegel. He's a renowned retired pediatric surgeon who writes about relationship and healing in the process. And he said, the power to heal comes from within, from your human mind. You know, if you allow positive affirmations directly into your subconscious mind, you will get better. And it will heal. So you could argue that MS, you know, we don't know what causes. Could be genetic, could be environmental. You have this permanent disease in your brain, in your spinal cord. How are you going to heal? And it's very, very important. And I think you heard today that, you know, even though you have all this fixed and genetic print that is going to play, you can alter that. You can alter that. And how can you do that? By having positive thoughts, by having proper nutrition, exercising. You heard today earlier very beautiful experiments where even though the patients had no limbs, just by thinking that they're moving the limbs, you saw the activity on the other side of the brain. Just by thinking. The mind is very, very powerful. Just as you think, things begin to unravel. And let me tell you one story. You know, I travel a lot and I enjoy traveling. And one day I was traveling back from Sweden and I was sitting on the plane and I said, where am I going to go next? And I closed my eyes and I was thinking about all the countries that I wanted to go. And I opened my eyes. I didn't focus on one. There were so many of them. But as I looked across the back of the seat, there's a pocket and there was a folded newspaper. And it said, come to Turkey. There was an ad, come to Turkey. And I said, you know what? That's it. I'm going to go to Turkey. And I told everybody I'm going to go to Turkey next summer. And within a month, I got a letter from one of the biggest MS conferences we have in the world, ACTRIMS. One of the organizers wrote me and said, we would like to invite you to come and give a talk. And the meeting was in Thessaloniki, in Greece, which is right next to Turkey. And I said, this is great. I'll go to Turkey, have fun, then go to Thessaloniki and give my talk. So there was no direct flight from Istanbul to Thessaloniki. I had to take a bus, which is a 12-hour bus ride. I said, that's great. I start in the morning, reach there in the evening. My talk is in the morning. So we started. About 3 hours at the border, we stopped to get our passports checked. And then the trouble started. The bus would not start. And the driver started working on it, and nothing it just didn't work. The cars coming by, the buses, they would not give us a ride. It went on like that for another 4 hours. And then we finally got a word that they will send another bus from Thessaloniki to get us. And that meant I was going to miss my talk. And I said, I think about this positive thinking. Let me put some thoughts in my brain. So I closed my eyes and I meditated. And MIndy is big about meditation. So I meditated and I said, I'm going to make it. And I could visualize myself giving a talk. And as I opened my eyes, the Mercedes-Benz rolled in. And everybody rushed, and of course the driver was nodding his head, so I knew they were not going to give it a ride. But I said, no, this guy is going to give me a ride. I went up to him and I said, could you please give me a ride to the next town? Because I need to be in Thessaloniki. I can rent a car and be in Thessaloniki. And he looked at me and I said, I'm going to Thessaloniki too. I said, please give me a ride and I'll pay you. He says, no, I don't need the money. I'll give you a ride. So I said, I have another friend with me and we have 3 suitcases. No problem. He gave us a ride, 8 hours, to our hotel. But as we started driving, he turned around and he said, why are you going to Thessaloniki? And I said, I'm an MS doctor and I'm going to give a talk. And as I'm talking, I can see the tears coming down his eyes, his cheeks. And I said, what's wrong? He said, I was just diagnosed with MS. And I said, who's your doctor? It was the same doctor who had sent me a letter inviting me to come to Thessaloniki. So these are not coincidences. When you think, when you put your thoughts in the subconscious mind and you really believe in it, it is going to happen. And we took photos because I said nobody in America would believe me. So we took photos, and if I have time, I'll share it with you. So this is Norman Cousins, and he wrote this book, Anatomy of an Illness, which chronicles his own recovery from a terminal arthritic condition by meditation, power of the positive thinking. And he said that the greatest force in the human body is the natural drive, the body to heal itself. But that force is not independent of the belief system. Everything begins with a belief. You have to believe in yourself. You have to believe that things are going to happen. So this is William James, who is the father of American psychology, and he said the power to move the world is in your subconscious mind. It is very powerful. And the body has a tremendous power to heal. Thank you very much.
Thank you, Dr. Khatri. Amazing. The power of thinking, of manifestation, fabulous. Thank you. Do we have any questions? Not a one. Lori, you have a question?
All right. Thank you so much. I appreciate it.
Wait.
Oh.
I'm kind of curious. Did you have an intuition with your patients that there was this energy blockage?
No. I think what happens is that a lot of patients subconsciously have negative thoughts, and it reflects physically, like it did with two of my patients. And their exam is a little bit unusual. Not that we would see it in patients. It's the way they hold their arm, the way they hold their legs. You can tell by exam that it's just not right. And that kind of creates a concern, and you investigate further. So I would not tell anybody that you have an energy block until I'm very convinced, 100%, 110%, that that's the case, right? So it's not the intuition, it's just the way you look at the patient, how they examine. And again, I think in my practice, and I've been caring for MS patients for the last 40 years, patients who are positive, who are always cheerful, they always do well. And I've noticed that patients who are very, very negative, they're always focusing on negative thoughts. They'll come to the clinic and say, "Doctor, I don't like this cane. I'm only if I can get rid of the cane." That's what they're focused on. They're not focused on things that they can do, things that they can enjoy. They're just focused on some of the negative things. And, sure enough, when the next time they come in, they're using a walker or a wheelchair. And I've seen patients with the positive thoughts. They're always happy, always, "Doctor, what can I do? I have fatigue, but I can do a lot of things. I can exercise, I can meditate, I can do yoga." They're always looking for things to do to improve, rather than be concerned about what the disability that they have and how it's progressing. It's not that you shouldn't be concerned, but I think what I'm saying is converting your positive, all of your thoughts into positive energy. Yeah. Thank you.
I am thrilled to introduce our last speaker of the day, MIndy Eisenberg. MIndy is the founder and director of Yoga Moves MS, a nonprofit 501c3 with the mission of improving the quality of life for individuals with MS, Parkinson's disease, and neuromuscular conditions. She is the author of Adaptive Yoga Moves Anybody, created for individuals with MS and neuromuscular conditions, and Adaptive Yoga Cards, daily yoga moves for all ages and abilities. MIndy has provided yoga therapy to individuals with mobility challenges for over 19 years and thrives on building a strong, mighty community for her students and families. She is a qualified mindfulness-based stress reduction teacher, certified Buteyko breathing instructor, and Reiki master. She created the widely acclaimed annual virtual Holistic Health and Wellness Forum for MS and presents at national MS, corporate, and yoga therapy organizations, and has trained hundreds of adaptive yoga instructors. She has a Bachelor of Science from Northwestern University and a Master of Health Services Administration from the University of Michigan. Please welcome MIndy Eisenberg, who will speak on the topic of adaptive yoga for MS.
Well, last speaker, but really we're going to do some moving together. I'm going to try to limit the talking and do some more moving with you, both in person and online. If anybody in person wants to come up here with us, come on. She's going, maybe, So yes, I'm going to move right along. People ask me why I do what I do. and there's this little angel in the corner called my mom who had primary progressive MS, and she took me through a journey of practicing myself for a decade and then gave me a little tap on the shoulder and said, okay, now it's time for you to go teach other people adaptive yoga, including teachers and people with MS who would like to use it as a practice for their mind, body, and spirit. So what we're going to do in our time together is we're going to breathe, because I know if you are watching this and you're here, you're breathing, right? Right. Check it out. Take one hand to your belly and just feel. Inhale through your nose. Is the belly inflating? I hope so. And then when you exhale, it goes back down. That is the key to this presentation. It is the foundation, and when you're breathing, you're doing yoga. So primarily what we're going to do today is we're going to do some moves together. Yoga is an umbrella. Today we've been talking a lot about nutrition and lifestyle and different types of modalities that fit under the holistic umbrella. And yoga can serve as a way of thinking about it. Breathing, mindful movement, lifestyle, many of the discussions, topics today fit right under there. It is a type of self-care. It is a type of self-care. And really, all the modalities, everybody here, including Dr. Khatri, taking care of yourself, positive attitude, that falls within that umbrella. So yoga is not really about self-improvement, though. It's about self-acceptance of where we're at. I have a lot of people who tell me, I can't do yoga. But that's because they think, right, Dr. Khatri? They're not thinking positively that, yes, they can. I'm going to tell you just a little story, is that I have a student who's also a neurologist who has MS, and this is when I first started teaching like 18 years ago. And I looked at her one day and I said, what's going on? Why are you laughing? What's going on? She goes, Mindy, I can't move my toes. And I'm like, well, but you could think about moving your toes even if they're not moving, which also goes along with what we've been talking about today, is picturing what you can do in your mind. And you never know what might happen. And then a few months later, I'm like, Jody, what's going on? You're laughing. She goes, I just moved my toes. So when we think that way, it's very possible it's going to happen. There is that neuroplastic pathway that she was creating when she thought about it. So you've heard this. Yoga can benefit flexibility. I think a lot of people think about stretching when they think of yoga, but yoga's not just flexibility. Yes, it could help some spasticity. It's also strength. Many of the poses call in this feeling of strength, like the warrior pose, and we're going to practice that. Very, very helpful with the proprioception that was also talked about today, the feeling of where you're at in space, which helps not only coordination but balance. Someone online asked a question about posture earlier today, and what we do in yoga is we have an optimal blueprint for posture. For instance, if you guys are seated or standing, you can feel your feet under your hips. If you're standing about feet hip distance apart, or seated, your heels are underneath your knees, and you're sitting tall with a tall spine, long spine, forward on your sitting bones. I'm giving a crash course in posture, but the point is there is a blueprint, but we are human beings, and so we're not forcing the body into this blueprint, but yes, we can use those ideas, those guidelines to improve our posture. Yes, it can help with fatigue. Many students say that they benefit very much from just the breathing helps with the fatigue. Also, there is restorative yoga where you stay in a pose for a while and kind of soak it in. The body is fully supported to relax. So that could be one way to help the fatigue. And the other one that we heard today was aerobic activity. So, or activity in movement can help the fatigue. Most of our students who walk into the room and they're feeling kind of tired when they come in, very often say they feel better afterwards. So in cognition, memory, focus, and mood, that all plays in because of this whole mind-body connection with the meditation and with the movement, mindful movement. So is yoga for MS different? It's really not, except we try to make it a lot of fun. We use the props such as a chair, a wall. They can help make sure that you feel safe when you're practicing balance. And yes, sitting on a chair could be a balance posture. No pain, all gain. That is our motto. You really should not be feeling pain when you're doing yoga. And sometimes it takes a while to decipher what is pain. So if you're practicing at home, you get to adjust the temperature, and you can also press the stop button. In an in-person class, we do a lot of pausing and then taking a break and encouraging that. So every student may not be doing the same thing at the same time. I'm kind of smiling because we do have someone in the audience who was in Michigan and moved to Madison, Wisconsin, and so she knows what I'm talking about with all the laughing in the room. So there are some fallacies or myths out there that you have to be flexible to do yoga. And the reality is, if you're stiff, you're going to benefit from it even more. It's not all about the stretching. It's not all about the postures. Believe it or not, it's really not about what that posture looks like, but it is what you feel inside of you. That's what it's about. And I think that also gets back to the power of thinking and thinking about how do I feel in this pose? What is the energy that I want to evoke in this pose? And you can attract that, and people will feel that who come near you in your poses. You don't have to wear fancy stuff. Like, I'm out here to show you, I wear this every day. It's called a t-shirt and some stretchy pants. You do not have to be fancy. We are all about come as you are, especially if you're at home. No one's going to know if you practice in your pajamas. It's not just exercise. So we talked a lot today about exercise, but the reality is yoga is more than that because of that holistic umbrella, because there's such a focus on the breathing and connecting the mind and body together. The breath is the thread. So yoga is not about touching your toes. That is a myth, but it is about what you learn on the way to potentially touching your toes. My students tell me why do they come to yoga? If you say, why do you come to yoga? They might give any of these answers, but the basic answer they give is because I feel better. People who have a certain condition want to push their body away. They don't like it anymore. They want to reject it and get rid of it or erase it and get a new one. But the yoga helps you to focus more on what you can do, and then you become more united. It becomes more of a mind, body, spirit practice. And of course, we pride ourselves on being a community, and so the benefits, they explode when you put people practicing together. And I believe in the whole energy. We don't have to be in the same room together. It's certainly very nice to practice together because you feel each other's energy, but you also can do it online and live, as we are able today to do that. When I first started, we weren't doing that. So this is just an example. People say, I can't do down dog. Well, Tony up there, he's doing the traditional down dog, the upside down V. But Marcia over here with the two chairs, she's doing a variation of it. She is still lengthening her spine, and she's probably still using some core there. So she's definitely getting some benefit of it. And actually this one right next to her with the two chairs, she's showing it against the wall. Her hands are against the wall. We call that wall dog. And so that one, she's opening up her shoulders, lengthening her spine, lengthening the back of her legs. And then Denise is against the wall in a chair. Students, I've been doing this for almost 2 decades, and I still learn when I go in the yoga classroom because everybody is different. I see you nodding. Yes, everybody is different. And so what happens is someone comes up with another idea. The creativity from adaptive yoga is part of the fun of it. So what works for one body might not necessarily be the thing that works for another body. And so you can see here, this is the famous tree pose. So this pose can help very much with balance, and we can play all different ways with it. And then she's against the wall, so she's using the wall and facing into the wall. She could also face away from the wall and have the wall back to her. Marcia's using a chair. Lori's showing tree pose, holding onto the back of the chair. And you can see Terry's holding the wall and the chair. There's so many different ways to go about this. Warrior pose. Here we have Suzanne in the chair, and then we've got Terry standing behind the chair. They're getting similar benefits. Suzanne is getting a stretch in the front of her quad, in front of her thigh, her back thigh. She's getting a nice lengthening through her side body, and she's undoubtedly using core to stay upright like that. Same thing, she's showing it seated with her knee on the blanket. She's probably also getting a really nice side body stretch on the left side of her body. So a lot of times, the pose, you're using the pose to get at what you were trying to do, like, oh, I'm feeling really tight, or I want to work on some posture today, or my shoulders are coming forward a lot, or whatever spasticity, maybe you're working on leg stretches for the day. So you can tailor the practice to what you want to do. And the practice could be 5 minutes, and it could be 10 minutes, and it certainly could be an hour long. So that's another thing. You get to tailor the practice to your needs. So we're going to play a little bit with movement now. And if anyone wants to call out, like either a pose or something in your body you want to work on, anyone want to throw that out? Either online or in person? Anything? Body part? Oh, we got it quiet here. All right. You guys want to work on anything? All right. All right. So they're starting in their mountain poses. And actually, one of you have a seat, please, so we can show one seated and one standing. All right. And I'm going to actually go right next to you, or I'll go kind of in front of you so you can see me. But then I'm in front of you. All right. So let's start by doing some cat-cow together, because one of the things, a lot of people say, oh, my back hurts me. And this is real accessible for people, is cat-cow. Now, I'm going to show it. If I go on the mat, Bill, are you going to see me? Okay, so I'm going to show traditional cat-cow. You're smiling. I think you want to come up here. Do you want to come up here? Oh, all right. Beth is going to do cat-cow. So we can do cat-cow in the chair, and we can do cat-cow on the floor. So I call it the earth. Anyway, so Beth is at first going to be in table pose. She's going to put her shoulder blades together. So notice her palms are down. Now, if somebody has sore wrists, we might give them blocks. She's going to show the blocks now. Sometimes we roll the mat, or we put a little rolled blanket under there. We have some, they're called yoga dumbbells, sometimes we use. But there are different ways to get at when somebody has a sore wrist. Best plan now. All right, we're just going to show the pose. So now you're going to take your chin to your chest. She's going to round her spine and take her tailbone down. That's the cat pose. Picture an angry cat ready to pounce at you. So now she's rounding her spine, and what's happening is she's getting a lot of lengthening. But there's something interesting about cat. Let's take you to cow, though, now. So now she's going to bring her shoulder blades together, and you can kind of see her belly swoops down and her tailbone goes up. And now you can kind of rock that forward and back. So here's our cat. Now the cat, we often do the exhale. And when we do the exhale, the belly pulls in. Now go to the cow pose, and then we inhale, and then the belly drops back down. There's a little toning, but not a lot. That's more intricate. But so see how she's exhaling. You can't see her exhaling, but try it yourself now, seated. So I'm going to show it seated. Here's a side view. And then everyone's going to do it with me. You guys online can do this too. Either you choose Beth version, or on your seat, you round your spine, take your chin to your chest. I'm hearing an echo. And we lean back. So that's the lengthening of the back of the spine. Yes, and then you lift your heart on the cow. Your shoulder blades roll up and back. Shoulder blades come together. And the head slightly lifts. We don't drop our chin back, but we lengthen the back of the neck. So as you do that, I hope as you're playing with this wave of your spine, there's a release going on. The spine likes to move in different directions. So when we're doing the cat pose, there's some flexion. And then when we do the cow pose, we're doing the opposite curve, so concave and convex. And one is more of a back bend, and one is more of a forward bend. Thank you for that. You're probably getting tired in that position for a while. How do you feel, Beth? Fabulous. Fabulous. So this is something you could do at your desk. You're sitting and you're watching a program, or you're sitting in the doctor's office and you just want to release your spine. You want to release your spine. So that's cat-cow, which is a nice simple one. Let's do a twist, because we might have had a nice meal and now it's been a while and we're able to digest it. Twists a day, at least a twist a day, at least a twist a day. Now, we could do a twist in bed, we could do a twist seated, and we can do a twist standing. And so we're just worth showing you a few different variations. So Lori's going to show the seated twist. She's going to take her left hand outside her right thigh and her right hand behind her. And so Beth's doing a version of a standing twist. Yeah, everybody try that. Now, by the way, when you go into these poses, you want to stay somewhere between 3 to 5 breaths. There's no golden rule. You don't want to rush through a twist. And so at least 3 to 5 breaths. Really feel it on one side and then the other. Turning the neck last. Yep, and you might gaze over the shoulder. So what's wonderful about a twist, not only is it wringing out the spine and moving those abdominal organs that can get kind of static, especially when we've been sitting or in one place for a long time, we're getting all that kind of movement there, helps digestion, and it opens up the shoulders. And this is a great little remedy for when the shoulders are rounding forward, to do a little twist. You could even do, if you were at a rest stop and you'd been driving for a while, you could do a twist. Just to show you another standing twist could look something like this, where I'm doing my wall dog, but then I take one arm out to the side and up. So that's a twist. Or here we are in a lunge. Front knee is bent. We could still do a twist like that. So there's so many different variations. And the one in bed, do you want to show the one where you could do a twist in bed? I like to say, some people are like, I can't get down to the earth. But this is one of those poses you could do in bed, which is Beth's going to lie down on her back. Take a little break, Beth. You've been working hard today. She's really good at that. Now, pull your knees in towards your chest. Give yourself a big hug. See, yoga is a hug. because it's something you're doing for yourself. Certainly you're interacting with people afterwards, but this is an independent practice. Now Beth's going to take her knees and let them drop to the right. You can there's variations, but we're going to let you take your knees towards the right, and then her arms are open. So it's very similar. When you were in the chair, you were doing a twist, and she's showing both ways. That's something we certainly could do lying down in bed. Really, really nice. Some people say that twists kind of wake them up a little bit, and some people say it helps them go to sleep. And I'll tell you a little secret, that some people do twists in the potty. You know, like you're on the toilet seat, and you're like, I'm sitting here for a while, and you want a little help. So a twist on the potty. I know, you think I'm a little, is that too much? Is that TMI? Dr. Khatri's laughing. It might be a little TMI, but it actually does work. It does work. All right, so Beth is actually showing a great version of restorative Shavasana. She's just having a little rest down there now. We're gonna, Shavasana, by the way, is one of the most important poses of the practice. It's the restorative pose at the end. It's considered a pose of non-doing, where you're enjoying stillness and quietude in your breath. And such a beautiful demo here. But some people, especially new students, say it's the hardest pose of all. Can you imagine that? Lying down and resting and focusing on the breath, becoming still is the hardest pose of all. And in our culture, I think that's very true. That giving yourself the permission to take the time. I also saw that on one of the slides. You know, how much leisure time, how much sleep is so very important. So let's show now, just stay right there. You don't move too much, honey. So we're going to show the leg stretch pose. And Laura, you can sit, and Beth's going to stay on the earth. And we're going to put a strap around Beth's leg. Good. She's going to soften her knee. And so how many of you have spasticity? I can't hear you over the screen, but is there anybody in this room who has spasticity? Yeah, we got a few. So this can be very, very helpful to stretch the back of the leg. Now, Beth is pretty flexible. If someone wasn't, we might have them bend the bottom knee and place the foot down. And is it okay if the leg does not straighten all the way? Is it okay if the leg doesn't straighten all the way? Thank you, Judy. Because Judy is an experienced Yoga Move student, she knows that we do not have to, if you're going to go to where your body tells you to go, you are not pushing past that. So what the idea behind the mindfulness is that you are feeling the sensation in your body. Now you can see Lori's doing the same pose, very nice posture. She's still using a strap. Now, if we had another chair, we might put it underneath her heel so she could rest her heel on there and maybe get a little bit more of a stretch. I'm a real fan of 2 and 3 chair yoga. Sometimes people feel more when they relax their leg and then they stretch. So it's real important to make the pose work for you rather than this picture in your mind of what it is supposed to look like. This is absolutely one of my favorite to do when it comes to spasticity in the legs. And these can be, you could do this a few times a day, you could do this once a day, and you can hold them for a while as well. Or now, what would you do if you had a spasm? You'd let it go. You'd let it go. You would never push past a spasm. We'll do one more pose before we end, because this is just a little taste for you, is warrior pose. And we're going to do warrior pose standing and warrior pose. Actually, they're showing the pose right there in warrior pose. So we're going to take one of you is going to sit. And you guys certainly could be doing this. in where you're seated. So we're going to bend our right knee. First, we're going to take a seat. Now you're going to face. So warrior 2, you're going to face our audience, and you're going to bend your right knee out to the side towards Beth, right? And then she's going to extend her left leg. Now she's got to find the place that's right for her with this knee. So some people may not lengthen this leg. They may bend it, and that's okay. Now, what are you feeling in your knee right now?
Feels normal.
Okay, so let's place the heel down here a little bit. There you go. How's that?
Yep.
Okay. So now, act like a fierce warrior, a peaceful warrior. Yes? Now, you can take your arms down whenever you want, or you can keep them up. And then, Beth, you show it standing. So she's going to take a big, wide stance on her mat. Now, what if balance is a concern? She might have a chair in front of her or to the side of her. You're right in front of Lori. Now, what are you thinking? We didn't really choreograph this.
I'll be off the mat. I'll use this chair. How's that?
Okay, that's awesome. That's awesome. So here we have 2 warriors, both beautiful. Oh, I love what I see in the audience too. I love it. So once you've done one side, you take a little break and then you go to the other side. And if it was fatiguing, you might take a longer break. So it just depends. And then we're going to take, now you're going to want to come back up and take a longer stance. Yep, because we want to keep that knee over the heel and ankle to protect ourselves. That's part of the optimal blueprint. You go, Dr. Khatri. You should have been up here demoing. Oh my goodness. Oh my goodness. That's wonderful, wonderful. And then come out of it when you're ready. Bring your feet back together. So if your feet have been wide for a while, you bring them back in. Bring them back in. Namaste. So are there any requests out there for a body part before we end? I love adapting the poses to people's requests, and that's part of what we do in our classes is we take requests because everybody's got different things going on in their bodies. And so when you make a yoga practice for yourself, when you do it at home, you might just choose a few poses depending upon what you're working on for the day. And maybe it's balance. Maybe it's spasticity. Maybe it's pain. Maybe it's shoulder work. And so we can tailor it to you. Tailor it to you. Let's take our arms out wide and then take your right arm over your left. Oops, echo. And then you hug yourself. Yes, yes. Oh, I love the hugs going on here. Yeah, you could shake it, rock. Notice how that rocking came in naturally. Big smiles. And then open up your arms wide and bring the left over the right. Big hug. Take your fingers. Maybe you feel just a little, give a little pressure there. Give yourself a little pressure point massage. And then when you're ready, I love this rocking. This is really, really nice. And then let that go. And then lift your shoulders up to your ears and roll them back. A common request is necks. Anybody get neck pain at all? Or you wake up with kind of a neck that feels a little tight? So what we want to do for that is roll the shoulders up and back, get kind of neutral, and then we're going to drop our ear towards the right shoulder. I'm mirroring you. We're mirroring you. Well, we're kind of doing both. So take one ear towards one shoulder and relax the shoulder. And then take about 3 breaths there. And then inhale and lift the head back up. Beautiful. And then we go to the other side. Yeah, so you're going to notice that one side is a little tighter than the other. and that's perfectly normal. And then inhale, come back up. We learn a lot about ourselves as we do these poses. We learn a lot about our body and what our body needs and perhaps how we're holding our body. I'm always learning, and the thing is what was also mentioned today is we're in a constant change. So depending upon how you slept the day before, what went on before you start your practice, whether you're fresh up or you're midway through your day, your practice is going to change. Let's take our arms up overhead, reach high to the sky, and then bring your hands towards your heart. Yeah, so this is a little mini sun salute. And then exhale, arms down. And inhale, they lift up. And bring your hands towards your heart. Good. Let's cross one hand over the other and bring your palms over your heart. And maybe you close your eyes here and feel your body breathing. So this is a nice soft breath in and out through the nose. We're not trying to force it. The breath is as it is. It's perfect just as it is. Lips are softly touching. Tongue is resting towards the back palate. You're feeling the rise and fall of your belly, and possibly the ribs expanding and softening, and a little subtle lift and settling back down to the heart. Just taking this pause in the day, this pause to regroup. It could be a 30-second pause, or it could be a full-blown meditation where you're sitting for a specific period of time. This is the way we nurture ourselves with compassion and self-acceptance and loving kindness. This is what this practice is about. This is what this day has been about. There is great power to heal within you, as you heard from Dr. Khatri and our other speakers who led us along this potential journey for brain health, lifestyle changes, to really live our best life. Breathing in and out softly. We're going to say this together. It's a practice of loving kindness mindful meditation. So you can start by thinking of somebody else in your life that you'd like to send this to. So you can picture them in your mind. May you be happy. You're saying this to this person or individual. Maybe you be healthy. May you be at ease and free from harm. And may my words, deeds, and actions contribute to your health, happiness, and peace. And then think of the community. It could be your family. It could be your friends. It could be more global. It could be our community that was gathering here today, that's gathering here. And so we're going to send the same message. May you be happy. May you be healthy.
May you be at peace and free from harm. And may my words, deeds, and actions contribute to your peace, health, and happiness. And finally, which can often be the hardest, is to yourself. You're going to say to yourself, may I be happy. May I be healthy. May I be free from harm and at ease. And may all that I do contribute to my health, happiness, peace, and joy. And we'll bring our palms together in front of our heart as we express gratitude for this practice, this powerful, powerful practices, and the powerful, powerful information that you learned today. And you'll softly open and close your eyes as you return to your space, wherever you may be. And as we end, I want you to know that we're not leaving you, that you can turn into our daily live classes that are free, that we do have an on-demand online library with all different kinds of classes, short and longer, and for specific types of practices. There is the Adaptive Yoga Moves Anybody book and Adaptive Yoga cards. And of course, you can reach us through our website, and I'm very open to texts and emails. So please reach out. And there's two of our wonderful teachers with our Detroit class, and they are wishing you, or they are saying to you, and we are all saying to each other as we reflect back to each other, because we all have light, that we honor, respect, acknowledge, feel this light in ourselves and towards each other. We see it in each other's gaze, and we feel it in their energy. Namaste, everyone. Namaste. As we close our day, I didn't bring my glasses up. But I want to thank everything and everybody that brought you to this space today. I want to thank all our wonderful, wonderful speakers. It's been our absolute pleasure to be in the Chicago area with you. There were people here from Chicago and Wisconsin primarily. We learned so much from each other. The questions were phenomenal. Thank you, thank you, thank you to our speakers. Your information was invaluable. We thank our generous sponsors. We could not do it without our sponsors. And all of the support that goes into this program. Lori works tirelessly from the beginning, before it's just when the event is just a concept, putting together all the pieces almost every day. She's always ahead of me. Beth is always coordinating our events. She's our program manager. And I'm sorry, vice president. So please join us. We want your feedback. Again, we're bribing you with, if you fill out the survey, you tell us how we did, then you get a free download from us. So we really do want to hear about you. In order to do more programs, we're always looking to improve. So again, thank you to our sponsors. I want to put on that slide, Bill, just so. All right, thank you, everybody. Namaste.